Good afternoon. The Senate Finance Committee is now in session. I will say to colleagues in the audience who are here to testify and or to listen that we will be as expeditious as possible. And when you testify, if you're not the lead sponsor on the bill, we are assigning 2 minutes for each person. So think about that. If there are key portions of your bill that you want to emphasize, think how you will best use your time. We'll start with Senate Bill 394, and we'll...
First three.
Okay. We have a sponsor panel. This is the President's bill, Jake Whitaker, Robin Rickard, and Aaron Russell. So the three of you may sit. Those mics are movable. You can move it. Okay. All right, we'll start with Jake Whitaker.
Thank you, Madam Chair. Mr. Vice Chair, members of the committee, my name is Jake Whitaker with the Governor's Legislative Office, here to testify in support of Senate Bill 394. I'm joined here by my colleague, Robin Rickard from the Opioid Operational Command Center, as well as Aaron Russell, the Chief of the Center of Harm Reduction Services. Senate Bill 394 provides funding for naloxone and requires healthcare facilities and other entities, including hospital emergency departments, treatment facilities, homeless service providers, and correctional facilities, make naloxone available to individuals at risk of an overdose. Since 2017 in Maryland, over 2,000 individuals a year have passed away from opioid overdoses. Naloxone is a fast-acting opioid overdose reversal drug, and expanding access to naloxone is key to reducing overdose fatalities. Research has shown that for every 60,000 doses that we give out, we can save 300 lives. This bill is important because naloxone is most effective when readily accessible to people who are likely to experience or witness an overdose. Data shows that individuals who receive naloxone are also much more likely to receive and look for treatment. So for the aforementioned reasons, we respectfully ask a favorable report for Senate Bill 394. And if okay with you, Madam Chair, I'd like to turn it over to Robin.
Sure, that's fine.
Thank you.
Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. My name is Robin Rickard. I'm the Executive Director of the Opioid Operational Command Center, and I am here to testify in support of Senate Bill 394, the Statewide Targeted Overdose Prevention Act of 2022. As was mentioned, the opioid crisis continues to claim the lives of far too many Marylanders each year. Naloxone is a safe and easy-to-use medication that can reverse an overdose, preventing death. Naloxone is not a controlled substance and has no potential for abuse. Targeted naloxone distribution is defined as providing naloxone to those at greatest risk of experiencing or witnessing an overdose, and expanding targeted naloxone distribution is a priority for our office. Maryland has done a tremendous job in establishing an infrastructure to support targeted naloxone distribution, but gaps remain in reaching those at highest risk of overdose. Through the passage of the STOP Act of 2022, certain systems, including emergency medical service providers, hospitals, behavioral health treatment providers, correctional settings, and homeless service organizations, would be authorized or required to offer naloxone to individuals at risk for overdose. Entities named in the legislation were identified based on extensive research and data presented in the Data-Informed Overdose Risk Mitigation 2020 Annual Report. The DORM initiative, formed out of the passage of the Chapter 211 Act of 2018, requires the Department of Health to create overdose risk profiles using linked data sets from individuals who died from an overdose. High-level findings from the DORM report showed that nearly 70% of individuals who died from an overdose between 2016 and 2020 had an interaction with a Maryland hospital in 4 years preceding their death. Additionally, overdose decedents who received outpatient mental health services in the public behavioral health system within 30 days of their death were more likely to be active in both mental health and substance use disorder services. There's also extensive literature that identifies that justice-involved populations are at greater risk of fatal overdose as compared to the general population. Colleagues from the Johns Hopkins Bloomberg School of Public Health found that in Maryland, individuals released from the prison system were 4 times more likely than the general public to die from an opioid overdose, and those engaged with parole and probation were 2 1/4 times more likely to die from a fatal overdose. Requiring these named entities to offer naloxone to individuals they serve is critical to ensure that naloxone is made available to those who need it the most. As Maryland continues to employ an all-hands-on-deck response to the opioid and overdose crisis, we believe that passing the STOP Act of 2022 is a critical step in reducing overdose-related mortality. And with that, I do urge a favorable report for Senate Bill 394. And Chair Kelly and Vice Chair Feldman, if it's okay with you, at this time, I'd like to turn it over to my colleague, Aaron Russell, Chief of the Center for Harm Reduction Services at the Department of Health.
Okay, thank you, Ms. Aaron Russell.
Thank you, Robin. Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. Again, my name is Aaron Russell. I lead the Center for Harm Reduction Services at the Maryland Department of Health. We are responsible for the Overdose Response Program, which means approving, supporting, and monitoring local entities that get naloxone out into the community. We also currently purchase all of the naloxone for this community distribution. The department is in support of Senate Bill 394, along with the proposed amendments. The STOP Act presents an opportunity to efficiently accelerate access to naloxone. Modeling studies show that when widely available in high-risk settings, we can reduce rates of overdose deaths by 30%. As you heard, all the agencies included in the STOP Act are backed by research on high-risk factors, notably recent periods of abstinence, previous non-fatal overdose, and co-occurring mental health disorders. And in 2021, just about 20% of people who got naloxone in Maryland were trained by these agencies, a small fraction of the total people that they serve. Despite years of investment and the overwhelming evidence that naloxone stops overdose deaths, it's clear that agencies in Maryland engaging high-risk individuals are not systematically offering it. This bill resolves that issue. I'll also add that legislative action to compel agencies to offer naloxone is imperative to address this gap, and it's backed by published evaluations of naloxone mandates that show that they work to rapidly expand access. This bill's greatest impact will be seen among vulnerable communities who do not have access to traditional healthcare services or insurance coverage. They will have naloxone placed in their hands by the systems and agencies they are already encountering. Finally, the STOP Act of 2022 builds on existing statute and structure. The Overdose Response Program has the requisite infrastructure in place that can be leveraged to institutionalize naloxone distribution, purchase the medication for programs, and track gaps and successes in distribution facilitated by the passage of this bill. Thank you again for your time and consideration. We request a favorable report with the administration's amendments of Senate Bill 394.
Thank you. Let me just ask one question before you sit down. For the persons that need the naloxone, how is it typically distributed in various communities? Do they need to go to a healthcare entity or to a community health center or what?
Currently, you can get naloxone from your medical provider, so a healthcare provider would have to write a prescription for a patient. The Overdose Response Program allows for that distribution to happen outside of the patient-provider relationship. And so a local organization can have a relationship with a provider who writes a standing order, allowing staff and volunteers to hand the naloxone out. And so we have currently 131 overdose response programs, and they're handing out naloxone in various settings. So it could be street outreach, like on a street corner. It could be in a treatment program in a detention center. We do have that happening currently. But
I
it's
asked
through the program.
because I've had a lot of people contact me complaining, the community association leaders, about people lined up on street corners or hanging around an entity where the naloxone is distributed in ways that are not healthy for the children in the community, for seniors who have to pass by and are sometimes afraid to see these large groups standing and sometimes appearing to them to be menacing and not a part of their local community. What are you guys doing regarding a better mode of distribution?
I'd like to clarify that we're talking about naloxone, which is the overdose reversal drug. So it's used in the emergency response to an overdose. It's not taken on a regular basis. And so it doesn't, the way in which it's distributed doesn't contribute to people milling around or standing around waiting for the drug. It's something that people carry with them in the event that they witness an overdose and can respond.
Well, I have no firsthand knowledge, but I've had a lot of reports from community people I know in my district concerned about it being an unseemly situation and somewhat menacing to, you know, seniors and to kids trying to go to school. All right, I've got questions from Vice Chair Feldman and then Senator Hayes.
Very briefly, you referenced administration amendments. We don't seem to have any amendments yet. Or is that something forthcoming, or you just make sure?
Mr. Vice Chair, they're included in our testimony today.
Okay. It's under Jake Wickett.
Yes, sir.
Okay, thank you.
Okay.
They're in the system.
All right, Senator Hayes.
Thank you, Madam Chair. Good bill. I think some of the testimony that's favorable with amendments brought up the idea of cost. And the amendments that you provided, it seems to have addressed that by saying that it would be offered to these organizations free of charge. But then the fiscal note talks a little bit about the local health departments. And so can you just give a little bit clarity? Is it going to be the responsibility of the state health department that will bear the cost of making sure these community-based organizations are supplied, or will it be the responsibility of the local health departments?
So Senator, I can take that question. The state will provide the funding for the naloxone distribution. We work
You
closely-
got to speak into the mic. We can't hear you.
The state will provide the funding for the naloxone distribution. We work closely with the Maryland Association of County Health Officers, who reviewed our budget language, and they're okay with it because they need to make sure, just from a budgetary perspective, that we're paying for it, and we've made that clear to that budget language.
All right, Senator Augustine?
Thank you. I was trying to understand, there's also been requests to go from 2 years to 1. Your amendment, that doesn't take that into consideration, or does it?
No, so some stakeholders have reached out to us about turning the effective date a little bit closer to the passage of the bill.
Right.
Our concern was that we didn't want to impose this requirement on different facilities and not give them adequate opportunity to be able to get their processes in place to be able to distribute the naloxone. But in working with providers, it seems like they don't need as much time, so we're open to considering those amendments.
Okay, great.
Yeah.
Thank you, I appreciate that.
All right. See no other questions? So thank you to this panel.
Thank you, Madam Chair.
All right, next we're going to hear from DePaul Nibber and from Ann Seacott.
Thank you so much, Madam Chair, Mr. Vice Chair, and members of the committee. My name is DePaul Nibber. I'm representing the Maryland Association of Counties in support of SB 394. Our counties have been at the forefront of the opioid response for countless years at this point. Naloxone has been an invaluable tool to our county officials in addressing this growing epidemic. Over the last 2 years, we've actually had records set for opioid-related overdoses. What we see in our county-run settings that are included in this bill is that naloxone is already available. And so this bill is essentially just codifying existing best practice. And so we urge a favorable report. Thank you.
Thank you. See no questions, so Ann.
Thank you, Madam Chair, members of the committee. Ann Seacott, representing the Maryland chapter of the National Council on Alcoholism and Drug Dependence. You also have written testimony from the Maryland Association for the Treatment of Opioid Dependence. We absolutely support efforts to get more naloxone out on the streets. This life-saving drug reverses overdoses and revives people who otherwise could quite likely die. I am struck that it was about 10 years ago that we stood here, demanding, passage of bill, urging passage of bill to even allow naloxone to be distributed as widely as it is. And we have to thank those of you who were here then, and certainly Senator Klausmeier has been the champion on this since the beginning. And now we're here supporting a bill that, actually mandates
the distribution of naloxone. So we are in support of that. We support very much the amendments that the administration, we thank them very much for working with us around the cost issue. We absolutely think that it should not take 2 years to develop a protocol, given how long naloxone has been around. And then finally, we're working with them on one more definitional amendment that we hope to clear up very soon and get to you. So we ask for your support for this bill.
Thank you. See no questions. Thank you very much.
Thank you.
All right, that ends the testimony on Senate Bill 394.
Next. You're up next. Okay, next we're going to turn to Chair Kelly's bill, Senate Bill 600. Madam Chair, we'll wait for you to go up and explain your bill. And if you want me to call your panel up here, you've got 3 folks signed up that appear to be part of your panel. David Rodwin, Stephanie Williams, and Tammy Bresnahan.
Thank you. Senate Bill 600, Health Facilities Residential Service Agencies Reporting Requirements. Colleagues, personal care aides, also called home care workers, provide care and support to older adults and to people with disabilities so they can stay in their homes and thrive. Personal care aides help with things like bathing, toileting, and eating. I'm sure that some of the members of this committee have relied on personal care aides to help loved ones. These workers not only provide care to our loved ones, they often become like family to those they serve. 90% of them in Maryland tend to be Black women. Most of these workers are paid with state money through Medicaid programs. Maryland is facing a home care worker workforce crisis. We simply do not have enough personal care aides to meet our state's growing need, and our state is suffering needlessly as a result. SB 600 would help Maryland solve our state's terrible shortage of home care workers in 2 ways. First, to solve the shortage, we need to know the 2 most basic things about these jobs. How much are workers being paid, and what benefits are they receiving? Right now, despite the fact that the Maryland Department of Health funds most home care in Maryland by paying residential service agencies for every hour of care a worker provides for a Medicaid recipient, the department does nothing to learn how much these workers are paid, or whether they are classified as employees or as independent contractors. We need to know how much workers are paid, and we need to know whether they're classified in one way or the other. Senate Bill 600 will get this critical information to policymakers so we can learn more about this workforce and make sure state policies allow for residential service agencies to make a profit while also ensuring that these jobs are good paying jobs that Maryland workers will want to accept. Second, as we all know, Congress has been talking about passing a reconciliation budget bill for much of the last year. There's one common thing in all of the different versions of that bill. That is hundreds of billions with a B of dollars for state Medicaid home care programs. But the bill language requires states to report to the federal government information on personal care aides, their wages and benefits, before states can get the money. Maryland will not be able to access these funds more than $1 billion for our state alone, unless we collect this information. Senate Bill 600 will ensure that when the federal bill passes, and it is expected to pass within a few months, Maryland will be able to access the funds without delay. We can then use that money to increase payment for residential service agencies while also increasing pay for workers. Last year, this committee and the Senate unanimously voted for a favorable report of Senate Bill 384. That was a bill that included the same reporting provisions that are in this bill. However, the version of the bill passed by the House did not include the reporting provisions which the federal resolution requires. So in other words, the money is available. We passed something last year to do this, but we left out a significant component in terms of the things that our state must meet in order to get the funds and to begin to work on the problem. My sponsor amendment to Senate Bill 600 addresses the concerns. And let me say something. Legislative Services is backed up. What we have before us today is an unofficial amendment that the bill room sent me because they are backed up. They don't have the official one yet. So we'll get you the official copy as soon as we have it. But so this amendment addresses the concerns that some business owners raised last year by making clear that none of the information they report to the Department of Health will be made public. Rather, it will be used by the department to create a report on Medicaid reimbursement rates and related issues so that we can make sure that residential service agencies receive enough money to make a profit and their workers make enough money to stay in the field so we can get started solving this terrible worker shortage that we're facing here in Maryland. Senate Bill 600 is a simple bill that doesn't ask a lot, just that residential service agencies report this basic information once a year on a form or in an electronic manner created by the Department of Health. It'll take 15 minutes to do once a year and will help our state solve the home care workforce crisis. In light of these considerations, I ask for a favorable report of Senate Bill 600 as amended, and I'll get everybody a copy of the amendments as soon as the official copy is out. Thank you.
Okay, before we turn to the panel, any questions for Chair Kelly, the sponsor? Okay, seeing none, we'll start with the panel. We're going to start with David Rodwin, and then we'll just go down the aisle.
Good
You got
afternoon.
2 minutes.
Good afternoon, Mr.
Yes.
Chair. If the chair would permit, Ms. Bresnahan has another hearing she needs to
Okay,
run to. and
absolutely, go on.
Thank you so much.
Thank you. Trying to juggle virtual to in-person has
Yep.
got its challenges. Thank you. I'm Tammy Bresnahan with ARP Maryland. I guess every time I'm here, I remind you that Maryland is aging, and we're all aging. And according to the Department of Aging, there are more people over the age of 65 than there are children in public school. And that tells us something about what's happening to Maryland. We're graying, and we're graying quickly. Senator Kelly laid out the bill. We support Senate Bill 600. We thank her for championing this issue. It is a fiduciary issue, and we think that it is state money and that we should understand how state dollars are being paid for. And it will help us to understand these workers, like Senator Kelly say, are usually marginalized. We don't want to create a cycle because these are very low-paid workers who they themselves, if they get sick and they don't have benefits, may need Medicaid in the future. So let's figure out what's going on. Let's figure out how to pay our workforce that takes care of our most vulnerable, and we ask you for a favorable report of Senate Bill 600. Thank you.
Okay, thank you. Before you rush out, any questions for Ms. Bresnahan since she's rushing to another hearing? Okay, seeing none. Okay,
Thank you.
we'll go back to you, Mr. Rodwin, and then we'll end with Ms. Williams. So, Mr. Rodwin, 2 minutes.
Thank you very much. Good afternoon, Mr. Chair, members of the committee. My name is David Rodwin. I'm an attorney at the Public Justice Center, where I focus on issues faced by Maryland's home care workers. I'd like to thank Chair Kelly for introducing and championing this important bill. There was a Maryland Matters piece from this past October that you may have seen, headlined, "Home Care for Older Adults Increased During COVID, but Direct Care Workers Remain Hard to Find." Almost 100,000 Marylanders rely on home care. These are your constituents, average people, spread throughout the state. But it's getting harder and harder for them to find the home care they rely on because too often home care jobs are simply bad jobs. They're not attracting enough workers to join the field, and turnover is off the charts. Workers are leaving home care jobs for places like Royal Farms and Walmart where they can get better wages and benefits. I want to point out something in the written testimony you have from Disability Rights Maryland, which you may know as Maryland Disability Law Center. They changed their name a few years ago. One of DRM's clients, an individual who uses a wheelchair and relies on home care workers to get in and out of that wheelchair, wasn't able to get a worker to come to their house for 48 straight hours and was forced to remain in their wheelchair for 2 straight days and nights. Stories like this will become more common as Maryland continues to age. There's a chart on the first page of my testimony showing just how fast Maryland will age over the next 20 years. Marylanders over 85 over the next 20 years will increase at a rate of 180%. This bill, as the first step to solve a problem, is to get the information needed to solve it, and that's what this bill does. For Medicaid-funded work only, so just to be clear, this applies only to Medicaid-funded work, only to state-funded work, and not to privately funded work or insurance-funded home care. The bill would require that home care agencies, with respect to work funded by Medicaid, report just workers' pay rates and whether the worker doing the work is classified as an employee or independent contractor. The bill specifies that this reporting is just once a year, and it'll be on a form or in an electronic manner created by the Department of Health. Shouldn't take more than a few minutes for any home care agency to do. The amendments make clear that home care agencies don't have to worry about any confidential business information getting out there. The Department of Health is prohibited from publishing any individualized data. Instead, they'll use it to create an annual report on Medicaid reimbursement rates, home care agency costs, and workers' wages and benefits. This is the information that policymakers need to ensure that Maryland has the home care workforce that your constituents need. With respect to benefits, I just want to clarify one thing. To understand whether a worker has benefits, you need to know whether they're classified as an employee or independent contractor, and that's because, as Ms. Williams will testify, employees get benefits, but independent contractors don't. So it's a shorthand way of knowing all the different benefits that a worker has. Finally, I'll just note that there's testimony supporting this bill from just about every stakeholder group you could imagine: AARP, Alzheimer's Association, Disability Rights Maryland, Image Center, which is one of Maryland's centers for independent living, serving people with disabilities across the state, New America, which is a national think tank, Marylanders for Patient Rights, home care business owners, and worker groups. There's very nearly unanimous support for this bill. And with that, I ask for a favorable report on SB 600. Thank you.
Okay, and let's go to Ms. Williams for her testimony, then we'll open up any questions.
Good afternoon. My name is Stephanie, and I'm a healthcare provider, and I'm one of them providers that's considered an independent contractor. I have no benefits. I work 35 hours a week with a client that has a disability. I do mostly everything for him and help him so that he can stay in the house that he's in. I don't think that is right that we have no benefits. We worked through the whole pandemic with nothing. Only things we got was the things we provided. And I'm trying to get people to come and help us be care providers, but the pay is short. I still make $11.75. It's not fair. Help us.
Okay, thank you, Ms. Williams.
Thank you.
For your I apologize that I
No,
didn't
you
want to
good.
cut you off. Okay, we're good?
Yes.
Okay. Questions from the committee? We're going to start with Senator Hayes, then Senator Reedy. Senator Hayes.
You won't get a chance to respond to this later, but there is some testimony in here that's unfavorable. And they state that there's as a result of negotiations and legislation that passed in 2021, that some of this will be taken care of in a checkbox. So I wanted to give you an opportunity to respond to that.
Yeah, thank you for that question. So first and foremost, I just want to be candid that we weren't planning on advocating for the introduction of this bill this year. It was the federal government's pushing $150 billion that would be made available to states only if they can produce data on 4 metrics: workers' wages, workers' benefits, turnover of workers, and vacancy of workers. The Department of Health already has the data it needs for turnover and vacancy. There is no Maryland agency no state agency that has the data on workers' wages and benefits. When this passes, and those who know more about this than I do say that it will pass, Maryland will not be able to access this money until it can produce that data to the federal government. So although there were reporting provisions in last year's bill, which was really focused on the misclassification of personal care aides as independent contractors, this year's bill is really about preparing Maryland to access that likely federal money, as well as informing policymakers as we move forward trying to address the home care workforce crisis that has only worsened over the last year. And then we also tried our best anyway to take into account the concerns raised last year to try and make it a little bit more acceptable. I do think we made some progress and we made it a better bill as a result, but I guess we didn't come quite far enough to get support.
Okay.
Thank you.
Senator Reedy.
Thank you, Mr. Chair. Just a question for you. One of the challenges, I think, in this space, based on what I know from people I've talked with in my community, is that the profit margin is almost non-existent when you're taking Medicaid patients. So I would imagine that one of the reasons that sometimes contract folks are used instead of employees is that very issue of margin, because, having to provide benefits is, a big expense. So is there any mechanism, and I was trying to look through the bill, but is there any mechanism for them to be able to explain why, these businesses to be able to explain why they have had to engage and why their split is the way it is?
You're absolutely right, Senator. The margins are very low. The current reimbursement rate for an hour of Medicaid-funded home care is $20.54. From that $20.54, the home care agency has to pay the worker, has to pay employment-related taxes, has to cover its own overhead, like the office rent and office staff, and also foots the bill for a nurse that has to come in 4 times a year to do an inspection. So there are really significant costs and the margins are low, and we need to increase the reimbursement rates. The purpose of the report that, under the sponsor amendments, the Department of Health would provide is to analyze just that question, what the reimbursement rates are, what the costs are to that residential service agency, and what workers' wages and benefits are, so that policymakers can then get actual data and not just rely on anecdote when trying to figure out what the appropriate reimbursement rate should be and what other policies, should be in place to ensure that business owners get enough so that they can make enough money to encourage them to continue doing the work and following the law when they do it.
That's good. And are you saying that, adding to the Medicaid reimbursement would be great with the money coming from the feds? You were talking earlier about how this report will help us access more money from the federal government, or is that the idea that would help, that could be used to help increase Medicaid rates, or is that a pot of money that has to go a bunch of different places? Can you speak to that?
Yeah, so the money that we expect from the federal government is solely for, in their terminology, it's Medicaid-funded home and community-based services. It's basically just Medicaid-funded home care. In the first bill, it was $400 billion. It was cut down to $150 billion. It seems like they're keeping right around $150 billion in all the current negotiations. So it's dedicated solely to Medicaid-funded home care. And they've put in all of these conditions that say states can apply for it, but when they do, they have to put forth this data on wages and benefits.
Okay, and one final question, if I might, Mr. Chair. So one concern I have whenever we talk about another step that we want these home providers to take I know they're getting Medicaid, so there's a reason we can ask for this information. But when we add more and more steps for them to follow and more bureaucracy for them to do, I do worry that at some point, not because of this study's fine, but at some point, you're gonna have people say, well, it's just not worth it for me to take Medicaid anymore either.
That's it.
So I'm concerned about that, because we don't want we need those placements, of course. So I think that's the balance we have to try to strike. I wonder a little bit about just adding more and more forms that people have to fill out. I do understand there's maybe no other way to get this information. I mean, could you speak to that a little bit? I want to be sure we're not adding more cumbersome requirements on, and kind of the suspicion that can arise is, they're trying to prove that I'm not doing enough for my workers.
Right.
When I think most of them are really trying to do what they can to sort of stay profitable beyond, as you pointed out, you get $20.54, and you have to, if they become employees, it makes it a lot more difficult. I don't know if you just speak to that.
Yeah,
that issue.
and that's one thing that we tried to improve on last year's bill. Last year's bill didn't specify how often the reporting would be done. It was sort of assumed it would be a sort of just one-time thing, but to address the concern about administrative burden, we put in just once a year and made clear that it was on a form developed by the department, so they don't need to affirmatively contact the department. But really, you know, the part of the purpose truly is to try and get more money for these residential service agencies, because they're the one cutting the checks to the workers, and workers can only really get enough to live on if the home care agencies are getting enough on the front end as well.
Yeah, I mean, I'm real sympathetic to the situation, like you brought someone to testify today. I mean, somebody came to testify today. I mean, I understand, and we deal with this in our ARCs too, with folks who
Right.
deal with developmentally disabled community. It's kind of the same challenges. You're paying somebody almost, maybe not even as much as they can make now at a Royal Farms or
Exactly.
something like that. And so I mean, I'm listening. I just wanted to kind of get your feedback. So thank you very much.
Thank you.
Okay, so the bottom line is that in terms of administrative burden, we're talking one report a year on a form prepared by the department. So I think I just want to make, we're clear here. Any other questions for the panel? Seeing none, that concludes, oh, I'm sorry, we've got an unfavorable, Dana Kaufman, I apologize. Dana, come on up here. We've got one witness unfavorable, Dana Kaufman.
Good afternoon, Chair Feldman, members of the committee. For the record, I'm Dana Kaufman. Today I'm representing the Maryland National Capital Home Care Association, and unfortunately, we are opposed to this bill. We were a little bit surprised to see it, given the fact that last session you did pass legislation that looked to address some of these issues that were raised. What the bill did last year, it was required the Attorney General's office to develop a guidance document that basically talked about the differences between independent contractors and employees, and it required an attestation by the person who is in charge of payroll that the agency understood the differences and is in compliance with the state's labor and employment laws. There was also a second portion that went more directly to this issue of pay rates, and that was a form that the RSA would have to complete with a checkbox that said whether or not they hired or used, I should say, independent contractors. That I have been in communication with both the Attorney General's office and the Maryland Department of Health, and it's my understanding that those documents are supposed to basically be rolled out they're completed, at least the guidance document is completed. The Department of Health is putting the final touches, and they're both supposed to roll out. So to us, it seemed a bit premature to put forward this bill while we were still implementing the bill from last session, which we thought addressed this issue. I think there is a bigger, though, issue that has basically been raised, but maybe kind of around the edges, and that is Medicaid funding. And Maryland is underfunding its Medicaid providers. There is no other way to say it. But you don't need this information to know that. Back in 2018, there was a study that was done because of legislation by the Hilltop Institute, and it showed very specifically the underfunding of the system. Since that time, the department was supposed to put together a 5-year plan for decreasing that differential between cost of reimbursement and cost to provide care. Unfortunately, that has not taken place. The COVID-19 pandemic has exacerbated those costs, but that study can be done, and those, shortfalls could be accounted for without this information. So yes, there definitely is an underfunding, but that underfunding can be looked at and tackled without this bill. The third issue I just want to raise is this federal legislation. And, it's difficult because, again, I'm not an expert on federal legislation, and most of the time those bills are like 1,000 pages. So I've tried to look into it a little bit more, but I think the federal legislation is the Build Back Better legislation, which, depending on who you talk to, whether or not it will pass. But I always thought that the issue was that the states could apply for a grant for additional funding, but I also don't know if Maryland would need to have this in place and this information in order to receive those funds, given the fact that it's federal legislation, and, usually federal overrides state. So I do think that there's a lot of issues, but most importantly, we do think it's premature, given the fact that we do have the bill from last year that's getting ready to be implemented. And we think that those issues could be addressed, again, through that legislation, as well as just continuing the Medicaid study and addressing the underfunding overall. Thank you very much.
Okay, thank you for your testimony. Let me just pick up, I guess I just have to go right to your last point, though. I understand it's 1,000 pages. On the other hand, as I understood the testimony, last year's bill has dealt with like information points 1 and 2. What Mr. Rodman was saying is, if there is such legislation coming down the pike, we need data on points 3 and 4, and bills last year didn't really get us there. So obviously, that's not an insignificant point. You kind of glossed over it, and I get the idea. It's a big bill. It's complicated. We don't know what the outcome is, but, we only come here. We're not going to be back here till next January. So if, we walk out here in April and that act passes, I'd hate to think that we're leaving federal dollars on the, on the table here. So I'll just make more commentary, but I'll open up. Senator Reedy, why don't you got the floor.
Yeah, thank you. Just to follow up, I guess, on a previous question or a statement you made. So really, we know possibly the biggest challenge facing our providers is the ones that take Medicaid, is the Medicaid underfunding, right? So
Correct.
that it's not a mystery, and your contention is not necessarily needing more studies and more data to know that. We might need other things in a study, but not so much that. It's not the main issue.
Yeah, 100%. The main issue is that Medicaid is underfunded. And Mr. Rodwin was correct as far as, the Medicaid reimbursement at $20.54 and what it has to cover. I mean, basically, the residential service agencies have to fund their own nurse. It doesn't cover their nurse that they have to have by regulation. So there is a lot of flaws in the Medicaid underfunding and what is provided. But to the point that you raised earlier, there comes a point, and there are residential service agencies who simply just don't take Medicaid anymore because they can't afford to.
As a follow-up on the manpower, the labor issue, we always, because this is an issue in the General Assembly year after year in different professions, where they say, well, these people they're not making them employees, they're contract. And contract is, the implication seems to always be the contract is bad because it doesn't provide benefits. And I'm sympathetic to saying, hey, we want people to have benefits. Can you speak to the industry and how much of it is moving to all contractual versus employee-based, or?
Good question. And I think that was one of the reasons that we did the checkbox to determine the extent that personal care aides are independent contractors versus employees. I know in the association, we have a mixed bag. We have those who use independent contractors and those who only use W-2s. But I don't know, I can't tell you if it's 50-50, 75, I just don't know.
I'd be curious, just because I think that some people could argue independent contractors, it gives more flexibility, obviously, to the business, but also even to the employees. But other people feel it's really like a slippery slope where then you're not providing. It'd be interesting to me to know kind of what the benefit versus the liability would, if there was enough money, would it be preferable to a business to have more employees as opposed to more contractual or not? But maybe that's an offline discussion. I just think it's an interesting, because we get that a lot in the General Assembly.
But I will tell you, by next session, you'll know that, because each residential service agency who takes Medicaid will have to indicate whether or not they use independent contractors or employees.
Because we've already passed something
Yeah,
to
because
tell
of the
us.
legislation that passed last year, correct?
Thank you very much. Thank you, Mr. Chair.
Okay, any additional questions for Ms. Kaufman? Okay, seeing none, that concludes the bill hearing on Senate Bill 600, and I'll yield back to you, Madam Chair.
Okay, we're going next to Senate Bill 380, Senator Benson. And Senator, you've got a sponsor panel, so maybe those people could come up there. Claire Bodie, Mark Ubens, and Zoe Weiss. Bill is Public Health Emergency and Allergy Treatment Program Nurse Practitioners.
Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. I'm happy to introduce Senate Bill 380, Public Health, Emergency and Allergy Treatment Program, Nurse Practitioners. This is a very important bill because it authorizes nurse practitioners to prescribe and dispense auto-injectionable epinephrine, commonly referred to as EpiPen, to certain certified holders who operate youth camps. Nurse practitioners licensed in Maryland have full practice and prescriptive authority according to the Annotated Code of Maryland statute and the Code of Maryland Regulations, COMAR 10270702. This allows them to independently practice and prescribe medicines or medications. This bill, adding nurse practitioners to those able to practice EpiPen, to youth camps, is merely a clarifying change. This bill, let me repeat that, this bill, adding nurse practitioners to those able to prescribe EpiPen to youth camps, is merely a clarifying change. It is important that nurse practitioners, especially those working at youth camps, can prescribe and dispense EpiPen and the related paraphernalia to keep the children in our camps around the state safe. Nurse practitioners can and do currently prescribe EpiPen to individuals who have documented life-threatening allergic reactions when exposed to certain environmental or food allergens. Youth camps should be a place of fun and safety for children, as it was for many of us growing up. This responsibility should not be placed solely on the child to correctly and profoundly communicate their food allergens to adults and safely inject themselves with a needle if something goes wrong at all times. A measure must be taken in the chance of a child not being able to communicate their allergens, safely apply an EpiPen to themselves, or when a parent is not present to do so. Children will be the future lawyers, doctors, or even senators of our county, of our state and our country. And all measures should be taken to preserve their precious lives. For this reason, I respectfully request a favorable response. With me today are members of the Nurse Practitioners Association of Maryland, who will further elaborate on this very serious change and answer any specific questions you may have. Thus, I urge a favorable report for Senate Bill 380. Thank you.
All right. You each will have 2 minutes, and let's start with Claire Bode.
Thank you, Madam Chair Kelly, and thank you to members of the committee. My name is Claire Bode. I'm a family nurse practitioner, and I'm representing the Nurse Practitioner Association of Maryland. We are a professional organization that advocates and represents the 8,000-plus nurse practitioners in the state of Maryland who are dedicated to delivering quality care to our residents. According to the Allergy and Asthma Network, 1 in 12 children have food allergies. 25% of allergic reactions occur without a previous diagnosis. There are 150 to 200 annual fatalities from food allergies and 40 fatalities from insect stings. Children may experience a life-threatening severe allergy, such as food or insect sting, for the first time while they are at these camps. Giving epinephrine early is cornerstone for successful management of anaphylaxis, which is the life-threatening reaction to an allergy, and for survival when this severe anaphylaxis occurs. Legally, nurse practitioners are able to prescribe epinephrine in other settings, such as hospitals, the clinics they work in, the private practices they work in, school health centers, daycares. Camps should be a part of this. It is essential that nurse practitioners be added to the legal list of authorized healthcare providers who prescribe, dispense, and administer epinephrine at these camps. This bill will protect pediatric patients by increasing access to life-saving medication and save lives. Thank you very much for your time and attention.
Thank you. All right, I don't see any questions, so we'll go next to Mark Ubens.
Hello, everyone. Thank you very much. My name is Mark Ubbins. I'm a nurse practitioner and a camp health supervisor for several camps in Maryland. Today, we're asking for nurse practitioners to be added to the list of authorized prescribers as part of the emergency allergy treatment program for youth camps. We're already included in every aspect of the program aside from providing the physical prescription. The focus of my testimony is going to be on how the camp operator goes about obtaining the epinephrine prescription. So they first must apply to be an emergency epinephrine certificate holder through the Department of Health and Mental Hygiene. Included in my written testimony was their application. You can see the application includes verifying that they're 18 years old, providing copies of their epinephrine protocols, providing a list of designated people at the camp whose scope of practice includes administering epinephrine. And they're also agreeing in writing to some other terms, including the storage and maintenance of the epinephrine. Additionally, they have to complete an emergency epinephrine certificate holder course, which I also included the application for this. This course is taught by a physician, a registered nurse, or a nurse practitioner, so we're already teaching the epinephrine certificate holder course. By the time that they submit these applications and obtain approval from the Department of Health and Mental Hygiene, they can then approach a prescriber to obtain their epinephrine to keep at the camp for undiagnosed anaphylaxis. Currently, the previous wording said physician, so we're asking for nurse practitioners also being added to that list so that they can also provide these prescriptions. The bill also includes some Good Samaritan-style provisions that have been in this proven bill for many, many years, intended to protect the layperson and prescriber when acting in good faith to save a life. These protections are intended for situations such as anaphylaxis, where an act of omission or inaction by the rescuer will almost certainly result in death and far exceed any potential or theoretical risk of an act of commission when providing life-saving care. It would be an injustice for a child to die because a rescuer is afraid to act in fear of litigation, or for a camp to avoid obtaining epinephrine for fear of litigation. Additionally, no child should die because a nurse practitioner has the inability to fill epinephrine to be used in these situations or refill it after it's emergently used at camp, even when they're acting as the camp health supervisor for that camp. Thank you for your support of nurse practitioners in allowing us to do what we do best, which is save lives. Thank you to Zoe, who you'll hear from, who provided the inspiration for us trying to get this bill put in place. And thank you, Senator Benson, for continuing to put our children first in supporting this bill.
Thank you. I see no questions, so we'll go next to Zoe. Zoe Boyce.
Good afternoon, Chair Kelly and members of the Senate Finance Committee.
Push that mic a little closer to your mouth. Yes, so we can hear you well.
Okay. Good afternoon, Chair Kelly and members of the Senate Finance Committee. My name is Zoe Weiss. I am 16 years old and live in North Bethesda. It's important that I share my story with you. An EpiPen saved my life. I attended the Green Acres Camp from age 4 until I was 12 and returned last summer as a counselor in training, working with 3- and 4-year-olds. I was outside with the campers in a tent for a theater activity. All of a sudden, I felt a searing pain where I had been seated. The counselor next to me noticed some bumps and went to get an ice pack. The bumps grew larger and more painful and started to burn. Red blotches began to cover my chest and my arms and my neck, and I felt a terrible heat growing inside of me. We rushed to the office, and within minutes my throat began to close, my chest felt tight, and it became harder and more difficult to breathe. I was going into anaphylactic shock. I had never experienced an anaphylactic reaction before. I had been stung years before without a reaction. I had never needed an EpiPen. I was confused and frightened and aware that this was a life-threatening situation. It turns out I had been stung by at least 12 wasps or hornets. The Green Acres staff had an EpiPen on site and administered it quickly under the guidance of Mark Ubens, our Green Acres nurse practitioner. Mark kept me calm and observed the trained staff administer the EpiPen. My breathing, while labored, did not get worse. Minutes later, the ambulance arrived and they quickly took me out to the emergency room at Suburban Hospital. The EpiPen treatment allowed enough time to get me safely to the hospital for further treatment. Without Green Acres having an EpiPen on hand, it would have been a very different outcome. It is very important for youth camps to have EpiPens for people like me who have undiagnosed allergic sensitivities. For this reason, I ask you to support Senate Bill 380. Thank you for this opportunity.
Thank you. Well, you did a good job. I don't see any questions, so we're glad that the EpiPen was available in that case and that you're here to testify so that we help our state to move forward in the right direction. Okay. Finally, Josh Howe.
Stand here.
That's fine.
Good afternoon, Madam Chair and members of the committee. My name is Josh Howe with Compass Government Relations, here on behalf of the Maryland Association for Justice, the Plaintiff Bar Association of Maryland, with over 1,600 members advocating for victims of negligence. I'm here in favorable with amendments report. So the bill establishes a new immunity outlined on page 3, section 13707, part B3. MAJ is historically critical of legislative grants of immunities and tries to offer clarifying amendments, or in this case, point to existing statutes that are similar when it comes to immunity. And I'd like to just mention that in 2018, this issue came to the General Assembly under a similar program having to do with institutions of higher education. Under that bill, this committee and both chambers adopted provisions in that section that established clarifying immunity amendments that would require those who dispense, store, or use auto-injectable epinephrine must also adhere to manufacturer standards of expiration and storage. Like I said, MAJ respectfully requests that the committee conform Senate Bill 380 to the Institution of Higher Education program that is outlined in subtitle 7A of this title. Thank you, and I can answer any questions.
Yeah, wouldn't you think that that's mainly why we want a person who is a practitioner and is licensed to be able to do this, to do it? And that's why we aren't saying that anybody could, or just an aide at the camp and so on.
Madam Chair, I would just respond with that this bill does have a new immunity outlined on that section, and we saw the immunity, we saw the existing statute, the existing subtitle in 7A, and we're just asking that this committee conform those immunity provisions that are already established in the Institution of Higher Education subtitle.
All right, but I just think you probably would agree, we ought not just have everybody doing this.
Yes, I agree.
It needs to be a licensed practitioner who knows.
We agree
what
that
they're doing.
that the nurse practitioner should be able to provide and prescribe, dispense the auto-injectable epinephrine at the youth camps. But we just hope that the committee would conform those provisions to the already existing provisions under the Institution of Higher Education program.
Thank you. Are there other questions? All right, thank you very much, and that ends the testimony on this bill. We're going next to Senate Bill 294, Senator Casserly, and you have a panel, let's see, Katie Perdiak, Carol Mcdermott, and Spencer Lovegrove for health automated external defibrillator, first aid, and CPR requirements for health clubs. So if the team could come up, thank you.
Good afternoon, Madam Chairman, colleagues. I'm here in support of Senate Bill 294. This is a bill to require health clubs to have automated external defibrillators, AED, on site and to have staff trained in how to use that equipment as well as first aid and CPR. This is the same requirement we currently have for schools, swimming pools, and some other public facilities. I know there was the only objections that I've seen, one was the industry had an objection that a lot of the health clubs have hours where they don't staff. And so I certainly think that where you take your key card and you can go in at 3 a.m. and work out if you want. And they're saying if you put staff on board, you'll drive their costs up. I would have no problem with an amendment to exempt those, make these apply during your normal business hours and not during those periods of time that the facilities were not staffed at all, where people are using a key card. Otherwise, we kind of defeat their 24-hour service. I know that Association for Justice has a position, as they did in the previous bill, on limiting clauses limiting liability. If the way the bill's written, if you didn't have an AED or someone trained, that would not give a cause of action to sue the health club. With what the Association for Justice would be proposing is that if you didn't have the AED or you didn't have the person with the proper training, that the entity would be subject to a lawsuit. So I'll leave it to the will of the committee on how you actually want to interpret this. But those are the two options as it's written versus what Association for Justice wants. At this time, I have a great panel here for you, and I just turn it over to them now. Thank you.
Thank you. All right, we'll go next to Katie Perdiak.
Hi, I'm Katie Pertiet, and I'm a survivor of sudden cardiac arrest in a Maryland Health Club facility. And I'm not a survivor because they were prepared for a cardiac event. I'm not a survivor because they had an AED, because they didn't. They didn't have any of these things. When I collapsed, they told somebody to call my husband. Really? Like, if that's all that had been done, I wouldn't be here. I nearly lost my life because this health club was not prepared. And I had no idea. I had moved to this state from another state where I'd worked at a health club. And I was AED and CPR certified before I could teach. I thought that was a norm. I thought that was the thing anyway. And it wasn't. And the only reason, I'm sorry, I'm like shaking and nervous. The only reason I'm alive is because there was a doctor taking that class, and she recognized the signs of distress. And when they were saying to call my husband, she was like, call an ambulance right now. She hardly has a pulse. And the only thing that brought me back to life was being shocked. And nobody should risk themselves by going to a health club facility. I'd gone to a doctor. I was told I was healthy. I was told, work on your weight. So what was I doing? I was at a health club working on my weight, just like I'd been told to do. Not every cardiac condition is visible from the outside. And the electrical malfunctions, I don't have heart disease, I don't have clogged arteries, I take care of myself, but I have an electrical malfunction. And a lot of people don't know that they have an electrical malfunction. And without CPR training and AED devices, people can die. And we need to save people with Bill 294. And I mean, AEDs are in malls, they're in churches, they're in schools. Why aren't they required in health clubs in Maryland? It just seems like a no-brainer to me. I could go on, but I've submitted written testimony as well that you'll see, and I think you'll all agree. And I appreciate Senator Casilli for taking my story and bringing this bill to your attention.
Okay, well, you did a good job.
Thank you.
All righty, we'll go next to Carol Mcdermott.
Thank you, Senator Cassidy. Katie, I'm glad you're here, and thank you for turning your remarkable story into a way to help others. Madam Chairwoman, Mr. Vice Chairman, members of the committee, thank you for your past kindness and support as I worked on legislation to place more AEDs throughout Maryland. You have already helped to heal one heart. My husband, Joe, was a joyful man who was not ready for his life to end. He rode motorcycles with former Vice Chairman Senator Astle. He was a Reiki master who helped Congressman Jamie Raskin during the fight for his life. He was an Anne Arundel County public school teacher for over 30 years. Joe was an officiant who united many couples in marriage, including our 2 daughters. He was a lot of fun and a loving, honorable, courageous, good man. But all his wisdom and strength could not save him. One moment he was laughing with friends, so much so, with so much enthusiasm for the life before him. Then he was on the ground, the victim of a sudden cardiac arrest, SCA. There was a nurse and state trooper on the scene. They started CPR immediately. Despite their best effort, nothing could save Joe but the blessed shock of an AED. He may still be with us if this inexpensive, simple instrument had been available. Over 365,000 Americans die each year from an SCA. That is roughly equivalent to the number who die from Alzheimer's disease, assaults with firearms, breast, cervical, colorectal, and prostate cancer, diabetes, HIV, house fires, motor vehicle accidents, and suicides combined. 38% of reported cardiac arrest victims are under the age of 59, 20% are under 49. Cedars-Sinai Institute states, compared to Caucasians, African Americans face twice the rate of SCA and are an average of 6 years younger. After 10 minutes without defibrillation, SCA survival is rare. The average response time for EMS in the United States is 9 minutes. Joe received his first shock at 11 minutes. I want to be Joe's wife, not his widow. Joe changed the course of so many lives. You can do the same by supporting this bill and help in the process of healing many hearts. I thank you. And I also want to mention that in each building here on campus, there's an AED at the security entrance. Thank you.
Thank you. All right, we're going next to Spencer Lovegrove.
My name's Dr. Spencer Lovegrove. Thanks for having me today. I'm an emergency medicine resident at University of Maryland in Baltimore. I'm here today on behalf of the Compress and Shock Foundation as well as myself. You'll hear from a couple other physicians here momentarily, so I don't want to belate the medical piece of the information too much. I'm like the two before me here to provide more personal testimony. I treat victims of sudden cardiac arrest every day or every few days in the emergency department, but unfortunately I've also lived it myself. When I was 12, my sister died from sudden cardiac arrest at the age of 18. She was running a training run 10 miles for Christopher Newport University when she collapsed and died. Unfortunately, everyone around her, the bystanders, they all called EMS like they thought they were supposed to do, but EMS got there 8 minutes later. And in the interim, no one felt comfortable doing CPR and no one had an AED. By the time EMS got there, her brain had been without blood flow for approximately 8 minutes, and because of that, she was pronounced brain dead a couple of days later. As I've gone and learned more since the age of 12 about medicine, I am left with the thought of how things could have been different if someone did know how to use an AED or known how to do CPR. So I would just promote this bill in hopes that we can change outcomes for future sudden cardiac arrest victims, starting in health clubs where young, healthy people like my sister are exercising and potentially unknowingly have an underlying cardiac condition that could lead to their death. And we could potentially prevent that if we have access to the proper equipment and proper training. Thank you.
Thank you. All right, we have two additional witnesses, Sammy Zakaria and Josh Howe.
You're Mike Abraham. We also have Mike Abraham.
It's okay. Timmy can present.
Did anybody? Well, are you, Josh, what is your name?
Michael Abraham.
We don't have you listed
Okay.
as a witness.
Medical doctor. He's a medical doctor with
The University of Maryland Emergency Department.
University of Maryland Emergency Department. I don't know what happened why he's not on the list.
Well, let me give you 60 seconds. You didn't get signed out.
Okay, so my name is Michael Abraham, and I'm an emergency physician, a faculty member at the University of Maryland Emergency Department. So I'm also a board member on the Compressant Shock Foundation. Our main goal as a non-for-profit is to teach people how to use AEDs and to do bystander CPR to prevent cases like we've heard about today. We're definitely in support of this bill, 294, to get AEDs everywhere. Health clubs especially, as people suffer out of hospital cardiac arrest while exercising, and having these devices nearby for trained people to utilize will definitely save lives and get healthy people back into the community and become functional members. If you do not do these, CPR can supply blood to the brain, but without the AED to shock, patients will not become neurologically intact, and you have devastating losses. So thank you for letting me have some time.
Are there any questions for anybody on this panel before we, all right, Senator Klossmeyer?
I don't know if anybody can answer this, but I know how important AEDs are. And, but is there any progress, or is there any way you have like portable AEDs that Joe Citizen can carry or anything? Do you know if there's anything like that?
So yes, the devices have become quite small. You can actually buy them on Amazon to carry for yourself, to have.
Okay.
They do require some service, but there are companies where you can buy personal ones. They've gotten to the size of, small computers that you can carry with you. So looking forward to having them in cars, personal cars, in all different types of places, so that they are publicly available. So you don't have to go into a facility to get it. If you are near an event where this happens, school events, kids sporting events where, there may not be support for these things, if you have one in your car, would be great.
Okay.
Do you think there's any training that people should have, or that just anybody could go get something from Amazon and try it?
The devices actually are very safe, and you can walk through them on the device. There's instructions or verbal instructions for many of them when you open them. The not-for-profit that I work for has teaching to train people how to use these, but the devices themselves are actually very self-sufficient, and you can pretty much teach people to do it based on the voice prompts and the pictures inside the package.
Okay, one last question. For the average Marylander who just might see something like that on Amazon and who may not think they need training from anybody, would you recommend that they go that route?
I don't personally have a problem with AEDs being public, like being in very many places, right? So if I happen to be on a scene where something happens, I only have my hands to do CPR and call 911. But the more people that have AEDs available to me, I can actually affect outcomes when I'm not working in the emergency department.
And the reason I'm asking, because this is slightly outside of the parameters of the bill, the way it is drafted, and so we want to know, okay.
And Madam Chairman, I'd just like to add that the next witness up would have more information, but in Virginia, they're pursuing a program where you encourage people to buy AEDs and keep them in their car. Then there's an app, and your app would say, it knows where you are, and when there's a cardiac event, it would tell you, hey, there's a cardiac event within 1 minute of you. Can you go over there with your AED?
Okay, well, we're getting beyond the scope of the bill that you have in front of us. Senator, Vice Chair Feldman has a
Yeah, well, I just wanted, because some folks on the committee weren't here when we were having the same debate about restaurants, and it was, contentious in all candor, but Ms. Mcdermott, who at that time, it was Senator Raskin, who now Congressman Raskin brought these bills. Ms. McDermott was a constituent of Senator Raskin, and I just did want to get one point out, because I do remember, and we've talked about this issue in the past. We one time, we had the head of the State Firefighters Association here in the building, And the question came up is asking him, the firefighter, the top firefighter in our state, if you had to pick in the Senate office building, you had to pick between a fire extinguisher and an AED, which one would you pick? And if you want to share for the committee what his answer was, I think it was pretty instructive.
Well, much to my surprise, you would think that the president of the Maryland Professional Firefighters Association would say, well, of course, a fire extinguisher. He said without hesitation he'd have an AED here instead.
Okay, I just want to get that point. Thank you, Ms. McDermott, for your
thank you.
testimony.
Okay.
And on
All
this
right,
item.
well, thanks to this panel, and we're going to our last two witnesses. Sammy Zakaria and also Josh Howell. All right.
Me?
You may go, yes, you have 2 minutes each.
Okay. Hi, thank you for the honor to present here. Thank you, Madam Vice Chair, honorable members of the Senate. So my name is Sammy Zachary. I'm a cardiologist and a critical care physician. I work at Johns Hopkins Baby Medical Center. I'm the medical director of the cardiac intensive care unit there. And so I'm on faculty at Johns Hopkins. And I am involved with Compressed and Shock Foundation, but I also represent the Maryland chapter of the American College of Cardiology. And you don't need me to tell you, you have plenty of testimonials about how sudden cardiac arrest, it affects a lot of people. And most people who have it don't have any signs of heart disease before they have an event. And in the gym setting, it's, most people go to the gym to get healthy, not to have a cardiac arrest. But in the short term, you can have higher rates of adrenaline, epinephrine, and that could lead to more heart attacks and arrhythmias. And absent an AED, even with good CPR, most of those people will die. Even with good CPR, about 90% will die by the time that they leave the hospital. So it's a big deal. And even those that survive, they have devastating outcomes. And that's where I see them in my cardiac ICU, where maybe CPR was started 4 minutes into their arrest. Maybe an AED shows up 12 minutes later. They get back blood flow, but their brain is gone. And that's devastating. It destroys families, and it leads to enormous amounts of suffering for both the patient and for the society. If an AED is nearby, it's a different story. If you have a ventricular arrhythmia and you have an AED and it's applied and used correctly, patients wake up in a day, 2 days, 3 days, and they go back to their normal lives. That's a game changer from being dead or neurologically devastated or living a normal life. I could tell you many examples, 18, 19-year-old kids who go back to college the next semester, or a 40-year-old man who's a construction worker who goes back and leads his team a few weeks later. They might have a defibrillator with them, but they'll go back to work. So this has been a problem for a long time. It's even worse in the COVID era. COVID causes a lot of inflammation. So even if you have a case of mild COVID, you're more likely to have a cardiovascular event in the subsequent year. And this was just published in Nature, which is a big medical journal. The risk is about 4 out of every 1,000 patients will have a cardiovascular event, and of them, a lot of them will be arrhythmias. So this is a big deal. And for this reason, the American College of Cardiology and the Maryland chapter of it supports Senate Bill 294.
Thank you very much. Okay, and then finally, we'll hear from Josh Howell.
Good afternoon, Madam Chair. Again, for the record, my name is Josh Howe with Compass Government Relations here on behalf of the Maryland Association for Justice. So our amendment is simple. It simply adds acting in accordance with this section on page 2, line 16. As mentioned earlier, the Maryland Association for Justice is critical of legislative grants of immunity and often tries to offer clarifying amendments or point to existing statutes. And so what this clarifying amendment would do would so basically, the bill lists a number of requirements for healthcare for health clubs, including having a certificate holder, a designated person with training in American Red Cross or equivalent standards in first aid, and cardiopulmonary resuscitation. And so, there's a list of requirements, but then on line 16, Part D, there's a immunity that would allow for an individual not to be held civilly liable for act or omission in the presence or use of failure of an automated external defibrillator. So essentially what that means is that there's a requirement to have the defibrillator on the wall, and there's no real recourse for a victim of a injury to hold people accountable that don't respond, even though that this bill is clearly trying to facilitate an immediate emergent response. So what all this is trying to do is say that if you're acting in accordance with the provisions outlined beginning on page 2, Part B, when it comes to the employee, then that employee wouldn't be held civilly liable.
Senator Feldman.
Yeah, Josh, just on this point, I mean, because we've had variations of this in a lot of bills, the issue of immunity of some sort, not having immunity, whether it was the university system, we had, I think, stuff last year. Okay, just so I'm clear, though, I mean, if the device is there and somebody has an incident, under your sort of language, is there an affirmative obligation to act if you're qualified? In other words, if you don't act, is the inaction expose you to a lawsuit? I'm trying to make sure I understand the parameters, and I know we've had, again, this discussion over the years in different contexts, but just on this, in this case.
Because the bill doesn't specify a duty, I don't think that adding this language would, be related to that question, Senator. I don't know if that
Okay,
answers.
I think this, we're gonna have to have, so, yeah, I just, that, either your answer and your prior answer kind of sort of suggested a little bit like maybe that's, it doesn't have duty language in it, but, okay, I'll just drop
We
it.
heard one of the witnesses on the first panel talk about the fact that in the middle of the night, if you're a key member of the health club and there aren't other people around and they don't have a duty to be there, that would be different than if it were during regular business hours when there is on-site staff that would be expected to utilize this tool.
I understand that there are more general Good Samaritan laws that occur in other portions of the code, and I think under that specific instance that person would be covered under those Good Samaritan laws.
Okay, Senator Kramer.
That's okay, Madam Chair. I think between your questioning and that of the Vice Chair, we need to take a look at the proposed amendment and the potential liability for someone acting in good faith might be. So, I guess we'll have that conversation.
Madam Chair, if I could just add in, the language of the bill says that an employee of a health club may not be held liable. This is not an exclusion for the health club itself. So if the health club doesn't have the AED, if they don't have the trained person, this does not impact. This is only the employee. And it says,
We'll take a look at it.
Okay.
I'm glad the issue is being raised. Thank you so very much. Okay.
Thank you.
Then that ends the testimony on this bill.
Thank you, Madam Chair. Thank you, Madam.
Okay.
Thank you.
We're going next to Senate Bill 420, Senator Roosevelt. All right. Senate Bill 420, Employment of Minors, Work Permits, Information Sharing.
Thank you, Madam Chair.
And
Here, or you want me to, I'm okay here?
yeah, and Lynn Lucci is testifying on
And
this.
there he
if
is.
You want to take a seat? All right.
Speak into the mic. Well, thank you. It's a pleasure to be back here in finance with you all. I have two bills today. This is the first of two. You'll be surprised they deal with work and workers. So the first one is designed to help businesses and to help young people. We have a system in this state, as most states do, of work permits for folks under 18 who have jobs. You can work for money as a 16 and 17-year-old, but you have to get a work permit signed by your parent and filed with the State Department of Labor. If you're younger than 16, you generally are prohibited from working, but there's some special provisions here. This bill only deals with the 16 and 17-year-olds and the work permits. There's a database of these work permits at the Department of Labor. And what this bill does is it says that that database will be made available through the Department of Labor or through local workforce boards to employers and apprenticeship sponsors who register with the Department of Labor or with the workforce board, so that those employers and apprenticeship sponsors who are looking for good, hardworking young people can find them. I mean, we have a huge labor shortage in the country right now, as we know. And one of the things that employers are looking for is young people with work ethic. Now, who has more work ethic than kids who are already working? And so we have a list of them at the Department of Labor, and so all this bill does is say that the information on who the kids are, how to get a hold of them, will be available to apprenticeship sponsors and employers, and actually it includes educational institutions, because there may be training programs, community colleges and others that want to know who are the kids who are really focused on work. It sets up that if the kid doesn't want the information shared with somebody who wants to offer them a $20 an hour job, they can opt out, so the privacy is protected. We passed a bill a couple of years ago, not through this committee, but through EHE, to do the same thing with kids in high school who have taken the military recruiting test. Historically, the results of the military recruiting tests, which are offered in our high schools, were only available to military recruiters. And so military recruiters go after the kids and say, here, you get a great career in the military, which is terrific. The SAT tests that are given for college, those results are sold to the colleges, which is why kids get all these contacts from colleges saying, we want you to come to my college, we want to come to my college. What was missing were the civilian employers. So we fixed that with the ASVAB test. Those can now be available to registered employers and apprenticeship, and this does the same thing for the work permits. Happy to answer questions.
Okay, yeah, because I'm a little bit confused. Let me ask you this. What is the deficit in the status quo that this bill is fixing?
Two deficits. The difficulty of employers finding, and I hear this all the time from employers, of 16, 17-year-old kids still in high school who are looking for work and who have a good work ethic and are ready to work. And so this provides those employers with the database of kids who have shown by getting a job that they're work ready.
Okay, now I'm just trying to be sure I understand what the status quo altogether is. Is it the case that this database that we have in the Department of Labor would have the information that even today an employer could use to get the information that they are looking for?
The Department of Labor has that information, yes.
So the bill is going to do what is different?
It basically sets up a system, a regulated system for the employers and the apprenticeship sponsors to get that information. Today, and this is a policy issue actually at the Department of Labor, it's not a law, because I've checked all that out. I came with a bill because they could do it by policy, but they felt it was better for it to be a bill, is they have the list, there's no system for interested employers and apprenticeship sponsors to get that information. And so this sets up a system where if you're an employer or apprenticeship sponsor who wants to find some of these kids, you register with the Department of Labor or with your local workforce board. They both have the information. And then through the department or the workforce board, you can get access to the information about the kids maybe in your area, if it's a geographic thing, or kids who work in a particular field that you may be interested in. So it's exactly, think of it like.
So the database that the state has right now
Yes.
is it subdivided by jurisdictions now?
Yes.
So I'm trying to see what value is being added by the bill. If I really wanted to hire some kids, and there's this state database in the department, and it's subdivided by jurisdictions, and by the type of work that the kid is available for, then what stops me from right now?
The Department of Labor will say, we're not authorized to give you that information.
Okay, so this just authorizes the department?
Essentially, that's right. I apologize, I wasn't clear. Yes.
Okay.
That's the reason it needs legislation.
Give you the information.
Yeah.
They ought to be ashamed of themselves.
No, they shouldn't be ashamed of themselves, but they're good people. They like to work with the legislature.
Okay, all right, okay.
If I may respond, though, briefly to that question in another way, the other value is to the kid. It's not just for the employers. The kid now has access to potentially a better job.
Okay. Senator Augustine?
Thank you, Madam Chair. Is it possibly a concern about the privacy of the
of the kids, myself having, you know,
Yep.
17-year-old who perhaps I don't want employers, I mean.
Yep, I got it.
To get that.
And so the bill says that they can opt out.
I understand that, but it seems, you know, that there's not a whole lot, I mean, there's not a whole lot around what that opt-out looks like. I mean, obviously you have it here, you know what I'm saying? I mean, are we leaving it to them to determine what that looks like? I mean, how are they going to get in touch with?
No,
I mean,
no,
it's
the
such a
bill
broad
leaves it, well,
group.
here, okay, fair enough, we could clarify that language if you want to. I mean, it leaves it to the department. I think, in talking with the department, they'd put a checkbox when you file the work permit saying, I don't want this shared with employers or something like that.
Okay, I would
That's the
definitely be
concept.
interested in seeing
That's the
that.
concept. Well, I'll work with you on some language on that.
Okay, thank
No,
you.
I get it.
Okay, are there any other questions? Senator, Chair, Vice Chair Spellman.
Yeah, Jim, just real quick, I mean, you know, I think Senator Augustine raises, actually was one of the things I want to ask, but just, seems like kind of some common sense. So is there any other state have a system, because you keep using the word system, you know, that's kind of worked out the kinks of a system?
The short
Working
answer,
out the privacy issues, opt-in, opt-out, whatever?
the short answer is I don't know.
Okay.
The precedent is that it has to be at least 10 years ago, during the O'Malley administration, the Labor Department then actually worked with a school program that was focused on trying to help kids who had jobs, and they agreed to allow them to survey the kids. So it's been done before, and that's why we know it exists, that's why we know it can work. I don't know about other states.
I mean, I'm just coming back to Senator Augustine's point, because, you know, since we're talking about minors, and we've had this in some other contexts about consent and parents, so it's not just the issue of the 16 or 17-year-olds, you know, what do the parents, I see the language here about that it's unless the parent, so who's the opting out? Is the parent doing the opt-out, or is it the child?
As I understand it, we can double
Okay.
check the mechanics, but the work permit has to be signed by the parent. So I think what the Labor Department would set it up so that when they file the work permit, they would approve it or not approve it.
Okay, because again, in other contexts, it's like, what if the parent and the child don't actually agree, you know?
No, I get that issue.
I don't want to
And
get in the weeds too much.
Senator
but-
Augustine had a bill that we debated on the floor dealing with mental health,
Yeah, right,
about the parent
exactly.
versus, and so, I mean, I think at one level it's complicated, at another level maybe it's a little less complicated, because this is about people being offered jobs.
No, I think.
And so it's not that dangerous.
No, I agree. Okay, Madam Chair, that's.
Thank you. We'll go now
And I think Senator Jennings has a question.
Oh, Senator Jennings.
How do they notify the minors? So if I'm a-
Basically, the employer who requested it was registered, could directly contact the worker.
So let's say I'm an employer.
Yep.
I find your name.
Yep.
Like, oh, I like this guy. I'm gonna go.
Yep.
I call you, you don't answer. Am I allowed to go knock on your door and do a home visit and say, hey, you know, I've got a company here. It's great. Why don't you come work for
Well,
me?
The short answer is yes, but the long answer is employers do this all the time trying to find workers. They advertise, they knock on doors, they hand out flyers. This is just narrowing the search to someone who actually is working. I mean, it's to make it more efficient for both of them.
I get that, but for an adult. You know, if Domino's Pizza wants to knock on my door and say, hey, we're
No, they
hiring
do
drivers.
it, they do it with young people now.
But, you know, a 15-year-old kid, what is it?
Not
work permit,
15-year-old,
14
16 and 17.
9 months? 16?
16 and 17.
Okay.
Let me address it. It's a good question, Senator. The law currently distinguishes between folks 16 and older and under 16. 16 under, the reason we have a work permit system is they are allowed to work. And that lots of them do, as everybody here knows. Many of us probably worked when we were 16 or 17 years old. So it's not like child labor. This is for a specific group of people. We already have a structure that allows them to work. And all it does is give those kids more opportunity and give those employers more opportunity to find the right match. And you're right. If somebody doesn't want to be contacted by an employer, it would be set up by the Department of Labor so they say, I don't want to be contacted, and therefore they wouldn't get the information. That's the idea of the protection, but I'm open to other ideas of protections. I get the issue.
Okay. All right, then we'll go next to Lynn Lucci.
Thank you, Madam Chair, members of the committee. What a pleasure to see all of you in person today. Well, I guess with this mask, I could be anybody, not just Lucci. But I represent the Maryland Workforce Alliance, It's a coalition of trade associations, labor unions, and apprenticeship providers, more than 40 of them who come together to support workforce legislation that they all agree on. And this is one. It's a very common sense piece of legislation. There are many sectors in the labor market that have shortages of workers, and here's a way to recruit them, possibly get them in an apprenticeship program, a training program, a youth apprenticeship program, a career technical education program at their high school, and find youth who are willing to get a job and get a good job. So we think this is a very good piece of legislation, a common sense piece of legislation, and the Workforce Alliance urges that you give it a favorable report.
Okay. Given the number of questions that members have been raising, do you think we need some amendments to clarify?
I don't. I usually don't want to, I mean, when I draft the bill, I don't want to look at too many things that would be foreseen and let the department issue the regulations, but I'd certainly be glad to work with the Senator, work with the committee to come up with some if it was needed.
Okay. Senator Jennings?
Just, last thing was, you're saying it's an opt-out. What about an opt-in instead?
I mean, I would narrow down the pool, but I mean, that's certainly another way of doing it. I mean, either way, it would be a box that you would check on the form, so
Okay.
either way would require parental action to look at it and make the decision, so I'm not sure it would have too much effect.
All right. Thank you very much.
Thank you.
Thank you.
Testimony on that bill. And you may stay right there.
I know.
Senator Rosa Pep for Senate Bill 421, primary and secondary schools, bus driver wages study. And if I could call up Aaron Appel, Maryland School Bus Contractors Association, and Peter Barron from Anne Arundel, representing Anne Arundel County. Okay.
Thank you. This is another workforce issue, but from a different perspective. This is from the wage perspective. Part of working is getting paid. And I think many of us, maybe all of us, this fall, had problems in our local school systems with shortages of bus drivers, school bus drivers. Very disruptive. It's an issue that I had not paid much attention to, but I had a little bit until this crisis. But I had a couple of years ago understood the Prince George's school system has had a continuing shortage of school bus drivers. And I tried to learn a little about it. Then when I saw the crisis, I dug into it more, and I talked with folks with the school systems. I talked with the private school bus companies. I talked with the unions representing school bus drivers. And basically, and with the county executive in Anne Arundel County, actually, who was very forward-leading with his Board of Education to make sure they raised wages for bus drivers, to get bus drivers so the kids could get to school. And I concluded that one of the problems in this area is that the wages of school bus drivers, and I'm sure there are lots of other people who work in school systems who have wage issues too, but this just deals with school bus drivers, often don't get the attention of the leadership of school systems that they might. It's understandable because most of the people who work for a school system are teachers. And so they get a lot of attention. They should get a lot of attention. But the folks who actually bring the kids to school need some attention too. And we've had shortages, not just because of wages. I'm sure there are other reasons as well. I mean, they're unusual hours for bus drivers, but for some people, those are good hours. They like the in the morning, in the afternoon, don't have to do stuff in between. They know which days they're working. But I heard repeatedly from everybody that the overall level of wages was a problem. So all this bill does is ask the Governor's Workforce Board to do a wage study and say, look, if we want to keep the vacancy rate for school bus drivers below 2%, and that's a somewhat arbitrary number. You can make it 5, you can make it 1, you can make it 3. What level of wages do we need looking at the marketplace to make sure that we have enough bus drivers to bring our kids to school? There have been 3 amendments suggested, which I'm going to get drafted. One is the department asked us to move the date for the study back by 3 months to September. And then the Howard County School System, in their testimony, raised some good questions about regional differences. That makes sense. The wages should be looked at in a regional context. And it shouldn't just be wages, it should include benefits. And there obviously are trade-offs there. So I'm going to draft some amendments along that line if you all are interested in them. Thank you, Madam Chair. Happy to answer questions.
Are there any questions? Okay, seeing none, then that is.
Thank you.
Okay. All right, now we're going to Aaron Appel.
Thank you, Madam Chair. Good afternoon, Madam Chair, Vice Chair, members. Erin Appel on behalf of the Maryland School Bus Contractors Association, which is the association of private companies that own and operate school buses under contract with the local school systems. As Senator Rosa Pett mentioned, as I'm sure you're all well aware, we are facing a severe school bus driver shortage here in Maryland. It's not new, it's been going on for years, but it definitely came to a head at the beginning of this school year with driver strikes throughout the state. And there are a number of factors contributing to the driver shortage, but high among them, probably the highest among them, is inadequate wages. School bus driver wages vary from county to county. They're set by the local school boards. Prior to this school year, school bus drivers were making far less than other Class B CDL holders, which is what school bus drivers are. As a result of the strikes, a number of jurisdictions have increased their school bus driver pay, but on average, they're still making far less than dump truck drivers, Amazon drivers, even DoorDash drivers, none of which have to deal with a busload of kids. And many counties raised wages by issuing signing and retention bonuses, which won't necessarily carry over into subsequent years. The bill before you, as Senator Rosa Pett mentioned, would require the Governor's Workforce Development Board to evaluate and report on the possibility of increasing wages for school bus drivers in Maryland. They play a vital role in our communities. We entrust them to drive our kids every day. And it's absolutely imperative that they are held to the highest safety standards, and they should be compensated accordingly. I recently spoke with one legislator who referred to driving a school bus as an entry-level position, but this simply isn't the case. School bus drivers are frequently parents. Oftentimes, they're single income earners, single family homes, or single income households, or retirees. These are individuals who are supporting themselves and their families, and they should be compensated fairly. Thank you for taking a hard look at how to best address this issue and making sure our kids have a reliable and safe transportation system to and from school each day. I urge a favorable report on Senate Bill 421. Thank you.
Thank you. Are there any questions? Okay, you guys must have done a good job.
There we go.
All right,
Thank you
then.
very much.
Thank you very much.
Thank you.
Okay. And we're going now to Senate Bill 530, Senator Benson. Maryland Fair Scheduling Act. Let's see. Could I ask Kayla Mock to come up? And Kelly, oh yeah, that's it. Okay.
Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the Finance Committee. I'm here today to present Senate Bill 530, the Fair Scheduling Act. This legislation, which is crucial to so many in our state, addresses growing concerns and indeed a growing crisis among working families. American workers increasingly need to balance employment with other responsibilities. But to what extent does the workplace accommodate their needs? The non-work responsibilities of the typical American worker have changed dramatically over the past 50 years, mainly as a result of the entrance of women to the workforce in large numbers. As a result, the fraction of households where all of the parents work full-time has nearly doubled, and the percentage of the full-time workers who are parents in full-time working families has increased dramatically. Because their parents are living longer, an increasing number of workers also find that they must take time for elderly care. This bill's purpose is to require employers to employ individuals in a food service facility or retail establishment to pay certain employees at a certain rate of pay for certain shifts of work, except under certain circumstances. This bill helps the working Marylander not to become inconvenienced by short-term notices by their employers regarding scheduling. By allowing employers to freely, unwarrantedly manipulate employees' schedule, you disadvantage the employee who may have a certain route to get to work, which takes a specific amount of money and time. This is why it is important to grant compensation for the worker when they are asked to come into work unexpectedly to cover for any inconveniences the scheduling has caused. We, as senators of this great state of Maryland, have a time when we are to arrive at work that is set in stone for the majority of our time serving. Retail workers and food service workers should be held to the same standard. When these unpredictable schedules are put in place, it makes it difficult for women to meet their job and caregiving responsibilities. Furthermore, these practices are especially harmful to single mothers. The collateral damage of this is we then have children, mainly the oldest sibling, if a part of a large household, who then becomes the secondary caretaker of their younger sibling, while the parent is out fulfilling a role that was inconveniently placed upon them. The child's responsibility thus increases, and a multitude of other things could begin to occur, such as poor grades in school due to home life and increased stress. Mothers are bringing home more family income than ever before, so they are essentially in making sure a family structure is kept by making sure the child care is taken care of, housing, transportation, and a host of other indispensable responsibility. Additionally, when hourly workers have workplace flexibility, productivity increases and absenteeism decreases. Productivity, retention, and reduced costs are important metrics for all businesses. While some benefits of fair scheduling practices, such as manager well-being, employee health, and retaining workers in whom a business has invented training, don't immediately show up in a traditional business case. They ultimately boast the bottom line. The new era of workers and families will not stand for this, which is why we have current events such as the Great Resignation, in which employees have been resigning from their jobs in the masses, just recently reaching record numbers in April of 2021. Long-standing dissatisfaction is one of the primary causes of this movement. Therefore, we must provide workplace flexibility and paid leave to strengthen our families, businesses, and economy. Therefore, I respectfully urge the committee to issue a favorable report for Senate Bill 530.
Okay, I don't see any questions, so we'll go to Kayla Mock. You have 2 minutes.
Good afternoon, Madam Chair, Vice Chair, members of the Senate Finance Committee. My name is Kayla Mock. I'm here with the United Food and Commercial Workers Union Local 400. We represent over 10,000 Marylanders working on the front lines of this ongoing pandemic in retail, grocery, food processing, distribution, law enforcement, healthcare. And I'd also, I'd like to thank Senator Benson for once again bringing this bill before and speaking so eloquently to the issues that are facing our workers. I've submitted written testimony talking about why this is good for workers, why this is good for business, but I really would like to tell a personal story today. My rise at the union is unique. I was a rank and file worker. I worked at Giant Food for 12 years before coming to the local. I had the pleasure of working with fair scheduling for my union contract, provided it. Because of that, I was able to go to school. I was able to help my mother raise her youngest child, and move forward in the world. And it was because I knew what my schedule was going to be. My mom, same, has worked at Giant Food for 39 years, in part because of fair scheduling. She was able to take care of her children and provide affordable health care, or child care and health care, but child care, because she knew what her schedule was going to be. Giant is still profitable. They still have access to a very flexible workforce. It works. This is more than a union issue. This is a worker issue. This is something that all of Marylanders should have access to. And also, while we understand that this bill has a financial impact, the truth is that the lack of this is already having a financial impact. I hear from workers all the time who don't have access to this, that are having to leave their jobs because of chemotherapy treatments, because of childcare issues, and the unpredictability of scheduling. And so we urge a favorable report from this committee on this bill, and thank you for your time.
Thank you. All right, now we're going to Kelly Locklear, Maryland Retailers, Mike O'Halloran from FIB, and we'll take Kirk McCauley, Lamada ACOG.
Good afternoon, honorable members of the committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Association, respectfully in opposition to this bill. So to begin, the majority of our members and employers already offer schedules 1 to 2 weeks in advance. The ability to schedule in response to sales, peak seasons, economic conditions, weather, or public events is essential when running a retail business. Many times, schedule changes are necessary, and by mandating that retailers create a schedule a certain amount of time out or incur pay penalties will severely impact their scheduling practices. For many industries, a schedule that is posted too far in advance does not take into account all of the factors necessary to create an accurate schedule. And companies that are forced to release a baseline schedule with limited hours will occur, i.e. the lowest number of hours needed to keep that business open. From there, as business inputs are known, such as truck arrival, special promotional events, community events, sporting events, etc., and others, hours will be added and employees will need to pick up those hours on an ad hoc basis. This rigid scheduling ignores the employees who choose jobs because of flexible scheduling, and it also ignores the differences in how businesses operate. I'd also add that many employees value the workplace flexibility afforded by the retail industry, and they are satisfied with the balance that their employer strikes between accommodating their needs and addressing key business needs. The unique scheduling flexibility in retail jobs our industry offers helps individuals balance important priorities in their lives, such as going to school, working another job, or raising a family. And finally, I would draw your attention to the fiscal note and the small business effect, as it very eloquently lays out the many problems associated with this bill. So with that, we would urge an unfavorable report, and I'm glad to answer any questions. Thank you.
Okay, are there any? Okay, then we'll.
Good afternoon, Madam Chair, Mr. Vice Chair. For the record, Mike O'Halloran on behalf of NFIB Maryland in respectful opposition to Senate Bill 530. Certainly appreciate the sponsors' passion for the issue, as she always does with her bills that she brings forward. But look, I think Kaylee hit all the high notes, particularly when we talk about the fiscal note and the small business impact. Admittedly, it does begin by saying this may not necessarily impact small businesses, because you read the bill and you hear about 10 stores nationwide. Well, I'm here to tell you, particularly for those operators, whether it's restaurant or retail, that are in a franchise agreement, those are small business owners, and they will be impacted and impacted adversely by this bill. And on the issue of flexibility, I dare say that this bill takes away that flexibility, particularly for on-call employees, as Kaylee touched on. These on-call employees, by and large, do it because it makes sense for them. And as the bill lays out, quite frankly, the penalties of adjusting a schedule for an on-call employee, if that employee doesn't like having an on-call shift, the good news is small businesses are hiring, and they're hiring for full-time employees. So where we are right now, given the labor shortage, I think it would be an ill-advised move to pass this bill, and for these reasons, we respectfully request an unfavorable report. Thank you.
Okay. I don't see any. All right, so Kirk McCauley, you're.
Yeah, Chairman Kelly, members of the Finance Committee, my name is Kirk McCauley, and I represent service stations, convenience stores, and repair facilities for WMDA. 530 is actually a little confusing in that franchises, I have dealers with a Subway within their store, but it's their only store. Yeah, there's thousands of Subways across the United States, but they only operate one. The Subway franchisor has nothing to do with their hiring, firing, hours of work, what they're paid. They're just a franchise. It has nothing to do with the business. It's truly a small business that operates, trying to keep their head above water right now. Please take the time to look at the physical notes. Kaylee touched on that, but there's significant cost in this bill. And it's also a little confusing that they say likely small business won't be affected, because they don't know what I was just talking about franchises. It's very confusing in the bill. Not a whole lot else. I think everything's been covered as far as what I had to say, and I appreciate it and like an unfavorable report.
Okay. All right, thank you. We're going next to Ellen Valentino and to Melvin Thompson.
Thank you and good afternoon. I'm Ellen Valentino. I'm here today on behalf of the Mid-Atlantic Petroleum Distributors Association, and I have nothing further to add. I think the panel before us covered all the issues that I was going to cover. Thank you.
Okay, Melvin.
Thank you very much, Madam Chair, members of the committee. Melvin Thompson, representing the Restaurant Association of Maryland, and we also strongly oppose this legislation. Many employees work in our industry because of the flexibility of our scheduling, and the food service industry actually schedules according to customer demand. When we have customers to support those shifts, we schedule employees. If we don't have customers, the food service business simply cannot afford to pay for shifts when you don't have customer revenue supporting that. And for these reasons and many others that are outlined in the fiscal note, we respectfully oppose this legislation. Thank you very much.
Thank you. Are there any questions? Okay, seeing none, thanks so much. And that ends the testimony on this bill. Okay, now finally, we're going to Senator Augustine, Senate Bill 292, Environment, Packaging Materials, Producer Responsibility. And we'll ask some of your sponsor panel to come on up now if it's okay. Yep. Scott Cassell, Dan Felton, Andrea Grooms.
Thank you, Madam Chair, members of the committee. Senator Malcolm Augustine here with testimony in support of Senate Bill 292, Extended Producer Responsibility for Packaging. Colleagues, this bill provides a mechanism for the Maryland Department of Environment to implement extended producer responsibility for packaging. MDE will oversee an EPR for packaging system that shifts the cost of recycling from taxpayers and local governments to producers of packaging and incents producers to make smarter packaging choices.
The bill creates the outline for a system in which producers will reimburse local governments for existing recycling services / operations and fund infrastructure investments to improve recycling. The bill also incentivizes producers to meet environmental goals for reducing packaging, using post-consumer recycled content in packaging, and improving recyclability. The EPR system will reduce packaging waste, increase demand for post-consumer recycled material, strengthening recycling markets, improve recycling infrastructure, while making better use of taxpayer dollars, saving local governments money. Colleagues, you know, when you have a piece of packaging, when you're purchasing a good, do you ever think about the packaging? I do not. I don't. I mean, obviously, we're drawn in by marketing and the way the packaging might work, but do we really think about the type of plastic that might be used to hold that big washing liquid thing that we have that sometimes leaks a little bit? You know what I'm saying? I don't think about it. But I dutifully put those items, it's one of my jobs in our house, I put them out for recycling every Wednesday, and it is so much more, you know, so much more of it has occurred now of that recycling material because of our changes in habits with the pandemic and all the deliveries and everything that are coming to our house and through e-commerce. The only thing that I kind of know about the process is that the plastic bags, after I put it in the bin, we no longer can put plastic bags, single-use plastic bags in there because they, you know, what they'll do is they will clog up the machines and so the stream gets kind of messy. And so we asked to get those things removed. And then we know that there are certain recyclables in there that have certain value greater than others. But we really don't know what's going on inside of there. We really don't. Right now, Maryland taxpayers, they bear that sole burden of paying to manage and dispose of that waste, including that packaging, through our taxes that we get when we pay for our solid waste disposal and recycling and things like that. Now, right now, we don't have any kind of a say in what that producer packaging is right now. We have no way to say what the type of thing that's going inside of that. And yet, we still have to manage our waste stream because we know that managing our waste stream is critical to our environment, our health, our financial, and our quality of life issues, just for all of us. We have to do better, and recycling is a priority for that. But the dynamics associated with that recycling really have changed. The purchase price for recycled materials has just collapsed in recent years, and it's had a real impact on our local governments, just to share with you all. In 2010, Baltimore City earned $600,000 from their recycling program. Now, by the time 2019 came around, it is costing Baltimore City $1.6 million in order to manage their recycling program. In 2015, in Charles County, they made around $30,000. Well, by the time it got around to 2019, it's costing Charles County $700,000 a year in order to manage this recycling program. Now, for me, that's a lot of money that we're having to pay. And it's money that could have gone to other things that you all know I care about, like litter reduction, education, you know, and just making sure that we get more recycling and environmental stewardship. Those are things that we could have done with that. And we could have obviously used that money to go to other things other than simply having no say in it at all. But this legislation creates a tool to help us to manage that. And packaging decisions matter. So a producer, and there's a great example that we have in Montgomery County where they did some research and they looked into this, and they found that the change of material makes such a big difference. There was a number 6 plastic cup. It's a kind of clear-looking polystyrene cup. It's a cup that Montgomery County, with their facilities, they have no way to recycle it. And so it ends up costing the county $135 per ton to remove it from the recycling stream and then to incinerate it. because that's what they have to do. It's not something that is able to be recycled. Versus if they had used, if the producer had used a nearly identical number one plastic cup, polyethylene terephthalene cup, it can easily be recycled and sold for a profit of $375 per ton. Now, right now, the way we're set up, there is no incentive in place for the producers to make that choice between the number one plastic cup and the number 6 plastic cup, and we're just simply left to contend with the problem. That's what this is really about. That's what this does. Now, how does it work? Now, first, MDE will undertake a needs assessment in partnership with local governments to assess state recycling and composting infrastructure and processes in the state. After that assessment, producers make packaging choices for products sold in Maryland, create a producer responsibility organization. Each PRO creates a plan that must be approved by MDE. The plan must detail performance goals for reducing packaging, using post-consumer recycled content in packaging, increase recyclability of packaging, and improving recycling rates. The plan must detail how the PRO will reimburse local governments for recycling services and fund the modernization of recycling infrastructure. An advisory council composed of diverse stakeholders, including local governments, collectors, processors, PROs, environment advocates, and residents, will provide input on the plans and to MDE. EPR for packaging is gaining momentum in the United States with bipartisan support. Maine has passed EPR, and Oregon also passed EPR legislation in 2021. And several other states are currently considering EPR packaging with significant bipartisan support. Now, Maryland taxpayers should not be left behind footing recycling bills that their counterparts in other states are not. EPR for packaging exists also across the globe. In countries around the world, many provinces in Canada, EPR packages recently passed in China and India. Nations well-established EPR packaging programs have higher recycling rates, and they also have lower rates of contamination in their recycling stream, things that we want. Now, in 2020, the Maryland General Assembly's Work Group on Waste Reduction and Recycling surveyed all our counties on recycling and waste. There were several themes that emerged, but most significantly for our county's response was, one, variable recycling markets are upending local government budgets, which I talked about. And number two, packaging waste is increasing due to our overpackaging and the rise of e-commerce and landfills nearing capacity with little room to expand. Therefore, reducing waste, increasing recyclability and compostability of packaging is critical. Now let's talk a little bit about cost, because people are worried about, will this shift cost? If you think about that washing powder that I was talking about, that we have, the liquid that's inside, the actual bottle on the outside is just a fraction of the cost really associated with the entire thing that's being purchased. But we're bearing the total cost, when you aggregate it all together, of those recycling pieces. In other words, it's such a small part that, particularly when we give them those incentives to change things, it's likely to be a very, very small amount that could potentially move through the system. But there really has not been much evidence of that it does move along to the consumers. But what it will do with this system is it will provide transparency, and it will allow for us to know where getting the people who are responsible for these things, that we know where they are, and that we have a system control it, so that we can make sure that the people who are putting these things and making these decisions are actually helping to pay for what we have. Now, we've had this has been a significant group of folks who have worked. You'll also hear from some people here where we've worked out some amendments with them, Chair Kelly. Some of those amendments, which may address some of what you may hear from some folks, is, and like you, I wanted to have them. They're not quite ready. They've been working on them because they are pretty significant, so I wanted to have them for our hearing, but they just didn't have them. But just to share with you some of what they do. They increase the small business threshold to $5 million. They add more detailed language around what a producer is, adopting more from Oregon as far as the definition. It provides requested restaurant clarification. There he is. All right. It amends out most breweries and wineries. It clarifies environmental goals, 25% less packaging material instead of waste, gives exemptions to pharmaceuticals, animal medicine products, change the composting to organic recycling, clarifies that MDE should have regulations on how local governments will be paid, and it makes clear that local governments, including counties and municipalities, just very clarifying information. Now, this bill will support local government. It will make better use of taxpayer dollars, it will bring needed infrastructure investments to our recycling systems, and it will help the environment. Madam Chair, I urge a favorable report on Senate Bill 292 as we get it amended. Thank you.
Thank you. All right, well, we've got three of your first three panelists there, so we'll start there with Scott Cassell and with Dan Felton and Andrea Grooms. You have 2 minutes each. I wish we had more. We've got to vote tonight on bills.
Chair Kelly and Vice Chair Feldman, members of the committee, my name is Scott Cassell. I'm the CEO and founder of an organization called the Product Stewardship Institute, and I'm here in strong support of SB 292. Our organization is a 21-year-old national nonprofit. We work exclusively on waste management issues and exclusively on extended producer responsibility bills, just like the one here. SB 292 is consistent with our own best practices model that we have worked on to reduce packaging waste. Maryland's recycling system is fragmented. It's severely disrupted by the loss of global recycling markets, and as a result, Maryland's local governments are experiencing significant recycling costs. Low-income communities, in addition, and communities of color continue to be disproportionately impacted by waste disposal. SB 292 is essential for Maryland. It's funded by the producers. It will save municipalities tens of millions of dollars. It increases the access to reuse, recycling, and composting across the state because it's going to create significant investments to stabilize and expand Maryland's recycling infrastructure. It will lower greenhouse gas emissions. It will create recycling jobs. And it will put the responsibility for packaging on those who decide what to put out on the market, what packaging to use. And it creates a strong financial incentive for more sustainable packaging so we don't have the same problems tomorrow. SB 292 is similar to successful packaging EPR systems around the world for over 35 years in Europe, Canada, and many other countries. It's similar to packaging bills that our organization is working with about a dozen different states on the same packaging EPR bills. It's similar in ways to the packaging EPR laws passed last year in Maine and Oregon. So it's a solid bill. It has broad support with the industry, government, and environmental groups, and I encourage you to pass it favorably out of committee, and I want to thank Senator Augustine for his leadership on this issue.
Thank you. All right, we're going next to Andrea Grooms.
My name is Andrea Grooms. I'm the director of the Prince George's County Department. Oh, sorry. My name is Andrea Grooms. I am the director of the Prince George's County Department of Environment. The Prince George's County Department of Environment runs the most advanced waste diversion and processing system in the state, one of the most advanced in the country. If I can't deal with it, no one else in this state can deal with it. These are the options if you go into the store and decide that you want to buy, well, mostly Tide. I needed one black bottle, but mostly Tide. This is the same product in a whole bunch of different containers. This container is PET. This is the same as the clear bottle. This clear bottle is the most valuable item that I can get in my recycling center in terms of a plastic. I can sell this, it will be made into a bottle again. This one is made out of clear HDPE. This is the second most valuable item I can get into my recycling center. It can be made into a bottle again. This is also PET, same as this product. It can be made into other items that can be made out of PET, but won't be made into a bottle because the majority of PET items are clear. Any woman who's ever dyed her hair knows you have to go light. You can't go lighter with dye. You can only go darker, which means that anytime you add dyes to a product, it has to be made into something the same color or darker. So everything else is HDPE. This is white HDPE. This is black HDPE. I had an orange one, but I actually used it for laundry. But the point is that these things, I literally ship these across the world in order to have them recycled because they have less value than this clear item that can be made into the same thing. I can't recycle either of these at all. Again, they're the same thing in a different package. The only reason that the packager has chosen is for their own expediency, their own marketing choices. Neither of these things can be practiced in the facilities that I have because these plastic bags get kind of wound up in all of the systems. And I just don't have advanced enough gear to be able to do it, and it doesn't make sense from an economic standpoint because more likely than not I would pay for it to be recycled. That's why 12% of what people bring in that could even be recycled is not recycled in my facility. Finally, this one looks like your most eco choice. It says on the front, Eco Box. This cardboard box can in fact be fully recycled in the United States, but inside of it is a plastic bag that's made out of a substance that I'm not able to recycle. So my point to all of this is that manufacturers have a choice. They've already made a choice that's super helpful for me. They could continue to do this, and what this law is trying to do is get them to make that better choice. So rather than shipping an item to India, rather than paying to have it recycled, rather than putting it back in the landfill, all I want to do is be able to provide the recycling for this, and I'd really prefer if the manufacturer paid it, that it went on the back of my residential taxpayers. Thank you.
Thank you. All right, we're going next to, did we get Scott Cassell? Or Dan Felton?
Thank you, Madam Chair Kelly, Vice Chair Feldman, members of the committee. For the record, my name is Dan Felton. I'm Executive Director of AmeriPen. That is the American Institute for Packaging and the Environment. We're a trade association based here in the U.S. that represents the entire packaging value chain. By that, I mean packaging suppliers, manufacturers, brand owners, who in this instance would most likely be the producer under this bill, as well as recyclers. AmeriPen has spent significant time over the last 10, 12 years working on this issue in the United States with people such as Scott, other stakeholders, and we support policies, including producer responsibility, that are results-based, effective and efficient, and equitable and fair. Senate Bill 292 largely meets this test, and we are therefore taking a position today of favorable with amendments. It is meaningful and significant that Senator Augustine and House Companion Bill sponsor Delegate Brooke Learman have drafted these bills with the collaboration and expertise of AmeriPen and other stakeholders. While not a perfect bill for all stakeholders and for Maryland residents, what bill is, we believe it is clearly moving in the right direction, leading Maryland to be the first state in which AmeriPen has been able to support this type of legislation. We look forward to continuing to work with all stakeholders to advance this important policy in Maryland. In the spirit of collaboration, our written comments submitted today highlight some outstanding issues. Senator Augustine mentioned several of those in a pending substitute we look forward to seeing in the near future. AmeriPen encourages this committee to pass Senate Bill 292 with amendments so we can continue the dialogue on how to increase packaging recovery and recycling in Maryland in a shared, meaningful, and responsible way. Thank you, members of the committee.
Thank you. All right, we've got a bunch of people. Yes, Senator Reedy.
Just a quick question, and I was in and out because I had to present another bill in committee and come back. So I apologize for that if this has been addressed. I compost, I recycle, my wife and I do, and I think it's a great thing for people to do. And I understand the idea of trying to shift the burden, which makes sense to me. When we reference poor and particularly disadvantaged communities that have always borne the brunt of bad environments, how do we make sure that we're not having the shift go to them on the front end of having to pay more for products because of these kinds of, because if we start charging more to the companies for producing things, that price gets built in. I thought the examples were great, some of the examples of how it's pretty simple to make something not have dye in it. I think that's great. And I'm all for incentivizing that kind of behavior, but I'm concerned about how do we make sure that, I can afford to pay a few more pennies for things, or, 15, 25, 30 cents more, but it does really hurt. It can hurt the same people we're trying to help. So can any of you want to comment on how we do that, particularly the groups that are involved in this?
Mm-hmm. I can comment on that. It's a great question, and no one wants the consumer prices to increase. And as a matter of fact, we've done a lot of research on this around Europe, around Canada. There's no evidence that that has happened from the producers who are actually running these programs for up to 35 years in Europe and up to 15 years in Canada. So there's no evidence that that is actually taking place. The other things to consider here is that we're paying for this twice right now. We're paying for it in the product we buy, and as was demonstrated here by Andrea, that we're paying for it in the disposal end. So we as taxpayers are paying for it twice. We have no control over, as Senator Augustine mentioned, no control over what is coming into the system. So we can reduce our costs, low income, as well as the rest of us, all across the board. So for that reason, I think it's really important that this bill pass. The other thing is that for this bill, there's laws passing all around the country, and if this was to happen, that we're increasing some of these costs, we would not be able to take advantage here of all the other benefits. So these laws are passing, let's say, in Maine, in Oregon, right now. You have multinational companies, certainly companies that are around the country in the United States.
I hate to butt in, but we're going a little beyond the question that he asked, and we've got a load of people waiting to testify on this bill, and then we've got to vote. Okay?
Sure.
Okay.
And just one very, very quick thing to add would just be that. I'm sorry.
We can't. All right, Leanna Powell and Jen Aoza, are those people here? All right, Dominique Butchko. Would someone help her? She's got a lot of stuff to do. Okay. And I'm going to ask for Sam Slatter. Okay, thanks so much for the last panel. You were very informative. Okay. Okay, you have 2 minutes each.
All right, thank you, Madam Chair, Mr. Vice Chair, members of the committee. My name is Jen Aoza. I am the Chief Sustainability Officer for Baltimore County, Maryland. And I'm pleased to be here today in support of Senate Bill 292. Baltimore County is the third most populous county in Maryland, and we are growing. And this has meant that our solid waste and recycling burdens are also growing. As our only municipal landfill continues to lose capacity, we are actively seeking strategies to both reduce and divert more solid waste to extend our landfill's useful life. Baltimore County offers many of our residents curbside collection of recyclable materials, which are then taken to our materials recovery facility, or we call it our MRF, in Cockeysville. Roughly 1/3, more than 30% of what goes through our MRF still ends up in our landfill. Much of this is contaminated materials or materials that are really not recyclable, but get thrown into that recycling bin by well-intentioned consumers. Things like plastic films and plastic packaging, plastic bags. Our MRF shuts down daily so that operators can untangle these plastic films and these unrecyclable materials from the machinery, costing us both time and money. This is where Senate Bill 292 can help local governments like ours. By sharing responsibility for packaging materials with the product manufacturer themselves, we see this as creating a ready incentive for those producers to reduce some, if not all, of this wasteful, hard-to-recycle packaging materials. Less packaging waste means less material through our MRF. It also means less material into our landfill, a cleaner recycling stream which we can monetize, and a more sustainable Baltimore County.
For these reasons, we respectfully request a favorable report on Senate Bill 292. I'd be happy to take any questions.
Okay, you did a good job.
Thank you.
Okay. Dominique Butchko.
Oh, sure.
And do we have Sam Shalat?
I think, are you Sam?
Okay.
I'm not, I'm Liana.
Oh.
All right. What about Angelica?
Oh, no, I'm Dominic. I'm
Bailey?
here.
Okay. All right. Go ahead.
All
You
right,
have 2
Madam
minutes
Chair,
each.
members of the committee, Dominic Butchko from Mako, thank you very much. In the interest of time, Mako urges a favorable report on this bill. It's a good bill. It gives local resources to counties trying to recycle. Thank you very much, Senator Augustine. Again, we wish a favorable report. Thank you.
Thank you. All right. Either of you.
All right. Good afternoon, Madam Chair, members. I'm Liana Powell. I'm here on behalf of Blue Water Baltimore. And first, while I was able to be here in person today, many of my colleagues were not, and we urge you to restore the ability to provide remote testimony. Blue Water Baltimore is a nonprofit organization, and essentially we're here on behalf of the environment to urge a favorable report on this bill. Trash is a crisis in the Baltimore Harbor, and any upstream solution like this is a step in the right direction for our environment and our communities. Disposable packaging causes major pollution problems throughout our watershed. It litters our neighborhoods, depresses property values, clogs storm drains, and exacerbates flooding. Since 2019, our organization alone has removed more than 9 tons of trash from our parks and neighborhoods, most of it consumer packaging. We are a small nonprofit. We cannot continue to burden our struggling communities with full responsibility for this waste. This bill begins to hold corporate interests accountable for their industry's damage, and it is imperative that we continue to fight for local control and oversight of its implementation. We urge a favorable report on this bill. Thank you.
Thank you. All right, we're going to call up next Michael Gruber, Martha Answorth.
Okay, all right. Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. My name is Mike Gruber. I'm with the Consumer Brands Association. Thanks for the opportunity to testify today on SB 292. The Consumer Brands Association is in favor of the bill with amendments, as it reflects the consumer packaged good industry's support for recycling system improvements and building a more circular economy to the benefit of consumers and the environment. The Consumer Brands Association represents the world's leading CPG companies. The industry plays a unique role as the single largest U.S. manufacturing employment sector. The industry adds $26 billion to Maryland's GDP and supports around 260,000 jobs in the state. We applaud the steps proposed in this legislation to create new strategies to improve the reduction, reuse, recovery, and recyclability of packaging. The CPG industry has made unprecedented packaging innovation commitments, and our support for well-designed EPR programs is rooted in what we view as clear principles, including allowing for an industry-funded and run producer responsibility organization to assess fees on packaging and direct those funds to strengthening recycling infrastructure. As you advance the bill, we respectfully request that you consider the recommendations provided in our written testimony. As drafted, the bill authorizes statewide recycling needs assessments to occur every 10 years. We think those may need to occur more frequently. We believe that producers, working with stakeholders and the state, can determine what waste reduction goals are achievable, establish baselines for a variety of producers, and factor in existing waste reduction activities. We support composting. However, the cost of building out capacity must be carefully weighed against strengthening recycling infrastructure and improving materials markets. As part of shared responsibility in improving end-of-product life systems, Consumer Brands is dedicated to supporting well-designed EPR programs and look forward to working with you to strengthen the bill. And thank you for your leadership on this issue, Senator.
Okay, thank you very much. Okay, you may go ahead.
Okay, good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. I'm Martha Ainsworth. I'm Chair of the Sierra Club Zero Waste Team in the Maryland chapter, speaking on behalf of the chapter's 70,000 members and supporters. The Sierra Club embraces the principle and objectives addressed by SB 292 that producers should be responsible for minimizing the environmental and social impacts of their products at all stages of their life cycle. Producer responsibility, however, requires more than simply reimbursing local governments for the cost of recycling their products. There must be incentives for them to redesign their products to minimize waste and make them reusable and recyclable. SB 292 creates a program both financed and managed by producers. This underscores the need for strong public oversight and accountability to ensure that targets are met and funds are used properly. There are improvements in this bill since last year, and we thank the sponsor for his leadership on this issue. However, there's very little accountability of producers for results. Only one target in the bill, no penalty for missing it or incentives to achieve it. We oppose inclusion of beverage containers in the bill on packaging because a beverage container deposit program would be far more effective in increasing recycling. We respectfully request the following amendments to provide greater accountability and oversight of the program managed by producers. First, additional performance targets on recycling and minimum post-consumer recycled content and meaningful financial incentives for achieving them. Second, verification of performance goals by an independent entity reporting directly to MDE. Third, removal of PROs from the Advisory Council to remove a conflict of interest. And finally, disallowing chemical recycling in meeting recycling targets. And the detailed language for the amendments is in our written testimony. But with these amendments, we respectfully request a favorable report on SB 292. Thank you.
Thank you. Okay, we're going next to the 4 unfavorables, I think we have. Chaz Miller, Pam Casemeyer, Lorenzo Bellamy, and Melvin Thompson. And depending on who gets to the table first, you may go in the order in which you would like.
Sorry, Madam Chairman, I didn't hear what you said, so.
Okay.
Madam Chairman, members of the Finance Committee, first and foremost, Pam Casemeyer here on behalf of the Maryland-Delaware Solid Waste Association, which is the local chapter of the National Waste and Recycling Association. Before I start my remarks, I just want to say how nice it is to see you all. It's been such a long time for many of you. So,
and we are all muffled behind these masks, so speak up.
All right, I'll talk a little louder, although no one's ever accused me of being too quiet.
Okay.
And I wanted to say in fairness, and you know because I'm before you quite often, we're here opposed not because we're here to oppose EPR, and in fact, we commend the sponsor and the House sponsor for working on this issue. But it'd be less than candid, in my opinion, we're opposed unless amended. You heard a lot of support with amendment, and they are supportive. Our national organization is supportive of EPR. The amendments, though, are very complicated, and many of the amendments that were raised, in our opinion, some of them will conflict with each other. So we're pleased to hear that there is a redraft coming with a lot of amendments that stakeholders have offered, but we haven't seen that yet. And so unless all of those amendments line up, we're very concerned because EPR is exceedingly complicated. The waste systems are exceedingly complicated. We're the private sector side. We're not here because the money flows to the public sector side. We work in concert with them all the time. But just not to take up a lot of your time because this bill is going to take a lot of work, but things like when you think about collection, some counties don't even collect waste. The individuals create their own contracts. Some counties have collection districts. Some counties have drop-off facilities. Each county is a little different. A lot of waste goes out of state to MRFs out of state. How does that get impacted? So there's a lot of complexity, and the objectives are good, but if the structure is wrong, it could have a significant amount of either duplication or unintended consequences or disruption of the current system. So you've got to do it very carefully. It's very complicated. 2 states have passed it. There's a lot of mixed opinion about those 2 states, even from those who are proposing it. One of the supporters said this could be the only state because the play out in the other states has not been good, even though there was hope at the beginning. So we think we need to be very, very careful as we move forward. My testimony has the amendments we need. I don't want to take a lot of your time. You've got a busy afternoon. But it's not that we're opposed. My testimony has our written support statement for EPR from the national organization. But this bill needs a lot of work, and I felt it less candid to pretend like we were close to fixing that, despite the very, very, very hard work of the sponsors. So I'm not trying to take away from that. There's a lot of time that's gone into this bill to date.
Okay, who's going next? Lorenzo?
Thank you, Madam Chair, Mr. Vice Chair, members of the committee. Lorenzo Bellamy on behalf of the American Forest and Paper Association. Senator Augustine, I echo many of the comments that my colleague and friend Pam Casemeyer has mentioned here. Unfortunately, we are, as an association, in opposition to the bill. However, I do look forward to having conversations with you in this committee to see what those amendments look like, and then to see where we can, I'm always looking for, common ground if there's a possibility of that. I'm just not sure in this current state if that's possible. I want to talk just very briefly. We submitted written testimony from the American Forest and Paper Association, and the paper industry has demonstrated measurable record of success in making paper and paper-based products and paper packaging more circular and sustainable through market-based approaches. For a highly recycled material like paper, even pizza boxes are recyclable, with widely accessible collection programs and robust and resilient end markets, EPR could disrupt efficient and successful paper recycling streams in an attempt to improve the least effective streams. Our industry, in fact, the recycling rates of our industry are so successful that some products are approaching the maximum achievable recycling rates. The recycling rate, for example, for container board or corrugated cardboard in 2020 was 88.8%. Old corrugated containers is already at 92.3%. In addition, 95.1% of Marylanders have access to residential curbside recycling. The state has a well-developed and accessible paper and paperboard recycling program, thus we believe negating the need for an EPR program. We respectfully ask policymakers, you all, to focus on legislation that improves recycling for materials with low recovery rates that contaminate the recycling stream. Legislation that was passed last year, House Bill 164, which is the Recycling Markets Development Bill, that can serve to support increased recycling rates for low-performing materials without new burdens on other industries. And also, currently, House Bill 217, which is a task force on recycling policy and recycling and wastewater systems in Maryland, that's currently pending in the ENT committee, we believe are better and more effective ways to addressing this complex issue, as Ms. Casemeyer has pointed out, of recycling and waste management. We'd be happy to work with this committee to amend this bill into House Bill 217. For those reasons, we respectfully oppose this bill.
Okay. Who's going next? Melvin?
Thank you very much, Madam Chair, members of the committee. I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and we are opposed to this legislation as it's currently drafted. This is a very complex bill, and many relevant details regarding the potential producer fees and the ultimate impact on the restaurant industry, its use of branded packaging for takeout and home delivery, remain unknown. Our membership includes independent restaurants, also franchisees and franchisors, and because no other state has fully implemented an EPR program, we don't know what this really means for our industry. In addition to our independent restaurants, we don't know the obligations for franchisors and franchisees. The concept of this legislation is very novel for our industry, and we've been doing a lot of background research, but we're happy to hear that Senator Augustine is willing to work with us on amendments. We've been in touch with the House sponsor and just received this afternoon the concept of some of the amendments they're working on to try to address our concerns. And so we will continue to work with both the House and the Senate sponsor on this issue, and we thank you very much for your time.
Thank you. That's promising. Okay.
I am Chaz Miller. I chair the Maryland Recycling Network's Legislative Task Force. Our members are public sector recycling managers, private sector recyclers, and advocates. We are the people most responsible for, directly responsible for operating Maryland's recycling programs. We have a long history of supporting EPR. We recently testified on the paint bill, and we want to modernize the existing electronics law. So it might seem odd that our board voted unanimously to oppose this bill as written. EPR for packaging is very simple in concept. It's very complicated in execution. Maryland's recycling system is not straightforward either. Local governments do not collect the same materials in the same way. Counties own 3 of the 6 processing facilities, and another is a nonprofit. 4 are single stream, 2 are dual stream. Many rural and exurban householders pay a contract fee for recycling, not a tax. And all these programs, however, share one characteristic. You've heard a lot recently about bad markets. Right now, markets are great. This is not 2019. Markets, with the exception of one curbside material, set a record in this last year, and prices remain very strong. These county MRFs are getting figures, six-digit figures for revenues right now because of the strength of these markets. Unfortunately, this bill does not note this complexity. It leaves many unanswered questions about how a new system will work, the extent to which local governments retain control of their programs, how those programs will operate, and what they will give up in exchange for EPR payments. Because let's face it, producers will not write a blank check. They are going to want to set boundaries on those payments. Our written testimony covers over about a dozen details that require legislative clarification in terms of who pays for what and who has control. We'll be delighted to see these amendments that we are here floating around, but unfortunately, we have not had a chance to see. Legislation cannot spell out everything, but it must set basic guidelines. It must understand the complexity of our existing system and understand the difference between theory and how EPR programs work in reality. You know, we simply cannot afford to fail in this endeavor. Thank you.
Thank you. Senator.
Thank you, Madam Chair. I really appreciate it. I was pretty clear on our good friend, Ms. Casemeyer's group and who they are and what they represent. But Mr.
Miller.
Mr. Miller, I am absolutely confounded that you are in here saying what you're saying. I looked at the website for who you all are. It says, we are a community passionate about building sustainable recycling programs. I am absolutely confounded that you are here in opposition to this bill when you know that we have EPR programs across the globe been going on for 35 years. We have very complicated things in this state that we manage. How is it that you are not in support of EPR? Could it possibly be that the second part on your website that it says who you are is that we see waste as a resource? Could you share with me the composition of your organization? I mean, who are you guys? I couldn't find it.
As I stated in my testimony, in fact, the opening paragraph, our members are public sector recycling managers. Our board consists of the recycling managers of at least 5 Maryland counties. Our board consists of people who operate MRFs, private sector side, and recycling advocates.
So
we have
how
been
do
in
you-
existence for 30 years
so-
now.
So how do you then match up the fact that you've had the counties, you've had MACO come in here, the people who are responsible for those places are supportive. Now, how do you match those two things up?
Because our members are the ones who actually run the programs. They're the ones who
Are you
actually
suggesting
deal
that
with their
Ms. Kroom
constituents.
does not run her program?
They're the ones.
I'm asking if, does Ms. Kroom run her program?
Wait a minute.
I'm just asking the question. Does she run her program?
She is the head of the program in Prince George's County, correct?
Okay. All right. I appreciate.
And I regret to say Prince George's County is not a member of the Maryland Recycling Network.
Well, that's
But we
probably,
would love for
you know
all
what,
to
you know what,
join.
and I understand that based on my concern with what is driving you in this conversation. I could see why Prince George's is not. Thank you so much. I appreciate your
Can I
testimony.
answer your question, please?
No, we're done. Thank you.
Well, then if I can't answer your question, you'll never find out.
All right. I don't see any other lights on, so I want to thank this panel for your testimony. And all right, that's the end of the bill hearing.